Alrighty. Welcome to the regular meeting of the Public Health and Safety Committee for November 20, 2024. I am Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I will ask the clerk to call the roll so we can verify quorum for this meeting.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison.
Here.
Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
We have 6 members present.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. There are 12 items on today's consent agenda. Item number 1 is accepting a redistribution funding from the Minnesota Board of Firefighter Training and Education. Item number 2 is accepting a grant from the Minnesota Department of Health grant for cannabis education. Item number 3 is accepting the Strong Foundations grant from the Minnesota Department of Health for implementation of evidence-based family home visiting services. Item number 4 is accepting a grant from Hennepin County Public Health for a cross-jurisdictional, trauma-informed mental well-being program called the Trusted Messenger Program. Item number 5 is accepting a grant from the Minnesota Department of Health to address the areas of public health responsibility and essential public health services in 2025. Item number 6 is authorizing an agreement to an existing lease to add a school-based clinic at Wellstone International High School. Item number 7 is accepting a grant from the U.S. Department of Housing and Urban Development grant for corrective lead-based paint hazard activities. Item number 8 is approving 5 public health advisory committee appointments. Item number 9 is approving a legislative directive for restorative programs to expand the public safety-related restorative services delivered by the city to include mediation services and victim services. Item number 10 is authorizing a memorandum of understanding with Hennepin County for the Lake Street Safety Center. Item number 11 is referring to staff the Safe Outdoor Space Health and Sanitation Ordinance to staff for further review and research. Item number 12 is directing the City Auditor's Office to research, analyze, and produce a national landscape analysis of youth and adolescent diversion and deflection, intervention, and delinquency prevention programs. Colleagues, are there any questions on these items? I'll first pass it on to Vice Chair Wansley.
Thank you, Chair Chavez. I just want to speak to my restorative programs legislative directive, which is item number 9 on the consent agenda. Since entering City Hall, I have been pretty vocal about the need for the city to close the gaps of services needed for victims. And in 2022, I brought a budget amendment forward to allocate funding for the city to begin to do this work. But unfortunately, it was unsuccessful, and it's unclear what actions, if any, have taken place to address those needs since then. And the recent and racialized shooting of resident Davis Maturi by his next-door neighbor underscores the urgent need for programs and services that can help mediate conflict between neighbors, as well as identify situations that require preventative or responsive intervention. The shooting also highlights the urgent need for victim services, both for victims of crime as well as bystanders or neighbors who may be secondarily impacted. And as outlined in the Safe and Thriving Communities Report and Plan, investing in healing and restoration services is crucial for interrupting cycles of violence and trauma. And I know later in the discussion portion of the agenda, we will be receiving a report from the New York University Policing Project regarding a gaps analysis on the city's existing safety services. And this directive builds upon that information so that we can receive more specific information about how this body can go about expanding restorative services to our residents and thus have a better sense of how we can prioritize and direct funds going into the 2026 budget season. I'm also aware that the Hennepin County's Attorney's Office and the City Attorney's Office have developed successful restorative programs on a small scale, but restorative services that have not been fully established or researched within the city attorney's office, or I think there's also haven't been fully established even within the Office of Community Safety, and we really need to have more concrete and coordinated responses, and I hope this directive will give us more information about that. I've also, and I'm pretty sure many of you have learned, especially in response to the shooting of Maturi, that there has been a newfound partnership between the NAACP and MPD to address mediation, and I'm still unaware of what funding has been allocated towards this partnership going in 2025, and hopefully this is something that maybe OCS can address during their part of the presentation. But overall, it seems like there is a shared appreciation and desire to pursue restorative services, and I'm hopeful that this directive will give us information on how we can concretely advance that work together. So, of course, I'm more than happy to stand for any questions and look forward to receiving this information later next year.
Thank you, Councilmember Rainville.
Thank you. I want to speak briefly to item 9 as well as 12, and I agree with Councilmember Wansley 100% on this. That it's very clear as our crime has increased in this city, there's more and more victims, and we're not doing enough to help them. And especially I think about the 7,000 cars that were stolen last year. That's 7,000 victims and their families and their neighbors. And we have to understand how we can help them heal. On item 12, with this youth and adolescent diversion, deflection, intervention, and delinquency prevention program, it's also very clear that our youth are having issues, and we are doing them a disservice by not helping them get back on track and steer them away from a life of crime. So I'm very happy to vote for both of these items and the whole consent agenda. Thank you.
Thank you, Council President Payne.
Thank you, Chair Chavez, and thank you for your co-authorship on the youth diversion and deflection. Thank you for your comments, Councilmember Rainville. This grew out of a body of work that my office started with the Hennepin County Attorney, MPD, as well as other stakeholders that are in the space of youth programming. And there's this real gap, especially when we're running into some of these bigger challenges around, things like young people who are so young that they can't even by state statute be brought forward for charges. We should be in front of those young people before they're in behavior where that would be the case. So we're not even talking about diversion programs. That's a post-charge diversion. We need to get ahead of some of these types of incidents and make sure that young people have supportive adults, caring adults that are around them that are helping them guide them just towards better futures. And I think that there's major gaps in the ecosystem. I don't know that every gap is going to be able to be filled by the city, but this is what this body of work is supposed to do, is start identifying those gaps so that we can start working with partners at the county and the state level to make sure that we have the type of programming to prevent these types of issues. So grateful for your co-authorship. And again, thank you both to Councilmember Rainville and Vice Chair Wansley, because I think we're all kind of marching in that direction. So thank you.
Councilmember Rainville, and thank you, Mr. President.
Thank you. And Councilmember Payne, I just want to, Council President Payne, I just want to echo that we are not alone in this, that the state and county are with us. And what this will do is help us understand what we can do, what the state should do, and what the county should do. So this very clear, concise data would be very, very important as we move forward. Thank you.
Thank you, Councilman Rainville, and agreed. I also am very happy about item number 10, the MOU with the Lake Street Safety Center for more community partners at the center. I've been hearing a lot of positive feedback in the community, and also a lot of feedback from residents about other things that they can think that could even make the Lakeview Safety Center even more effective. So that's conversations I'm going to be reaching out to Director Harrington and the Office of Community Safety, because there's a lot of great feedback we're hearing from the community on ways to even increase services there. It's a really great thing for the city of Minneapolis. I'm hearing a lot of positive things, and just it's always good to continue to see this project moving forward and more items on the agenda to make sure that it's even more successful. So very happy about that item too. Councilmember Rainville, are you on cue?
Yes, I'm a chatty Cathy today. You have to forgive me. I went and worked out this morning, so everything's flowing, everything's working here. But I just wanted to comment. Chair Chavez and I spoke briefly before the meeting, and I complimented him on the safety center because it is, bottom line, it's a lot easier to go into your own neighborhood to get services than it is to come downtown. And you had commented, Chair, that you're finding that even more services could be available in the neighborhood, right where people are, to meet them in place and time. So this is great. I'm glad it's working out. I'll be voting for this as well.
Thank you, Councilmember Rainville. Council President Payne.
Councilmember Rainville made me realize, this is the last meeting of the year, and I just wanted to take a moment to just appreciate your leadership. I was vice chair of this committee last term. The majority of us on city council were new to this role. We all didn't exactly know how we ought to be functioning in these roles, let alone functioning as chairs. With the new government structure, a lot of our capacity was taken up with redefining some of the structure of the government. And it's really been this term that we've had an opportunity to start flexing different muscles. And I think that you've done an amazing job showing what we can do as city council through this committee work. Both you and Vice Chair Wansley, I think, have brought forward so much work through this committee, so many extremely valuable presentations, whether it's from our leadership in the Office of Community Safety or leaders at the state level around the opiate response. I think we've just done a tremendous amount of work in this committee, and I just want to express some gratitude.
Thank you, Council President Payne. We really appreciate it and appreciate all the work that staff has done to establish the Lakeview Safety Center. So again, I'll be reaching out to staff on other stuff that can help even make the center even better. So I'm super excited for that. With that, colleagues, I don't see anybody else on queue. So I'll move approval of items 1 through 12. Given that there's no discussion, all those in favor say aye. Aye. Those opposed say nay. That carries, and the consent agenda is approved. Well, with that, we'll move on to our 5 remaining discussion items. Our first discussion item is receiving and filing an update relating to the work of the Office of Community Safety from the past quarter and a preview of the upcoming work. So with that, I'll call up Commissioner Barnett and Director Amanda Harrington.
Good afternoon. I am Todd Barnett, the Commissioner of Community Safety for the City of Minneapolis. I'm going to give you an update on the third quarter and some of the things that are happening in the fourth quarter as well. With me today are some first-time presenters, just letting you know, from Emergency Management. We'll have our director here, Chief Tyner from Fire is out, so we'll have Luke fill in. And then for Emergency Communications Center, Leticia will be here for Director Hodney. So just letting you know that. Well, as you know, 2022, the Office of Community Safety was established through the government restructure. There are 5 departments there, of course, 911, Emergency Management, Fire, Neighborhood Safety, and the Police Department. Although the office is fairly new, our departments aren't, and Fire and of course Police have been around for decades, and 911. So we continue the work of all the departments under community safety, and also try to partner and collaborate with other departments, other community organizations, the county and the state. Our mission, of course, is to provide a coordinated, comprehensive, and equitable safety services to all residents and visitors. And our vision for this city is a city where all people feel safe, social disparities are eliminated, and all residents can access opportunities and resources. For the third quarter and the fourth quarter, of course, some of the highlights. One you will hear about later today is the NYU Policing Project Gap and Assess analysis. That analysis is so important. It's a recommendation out of the Safe and Thriving Community Report, and it's important to inform us in help us understand where there's areas of strength that we have and where there's area that we can grow. And we'll have representatives from NYU Policing Project, of course, present with Director Amanda Harrington today. Of course, the Lake Street Community Safety Center is huge for us to be able to open that on November 4th. And thank you to the council members. Councilmember Chavez, I know you were able to make it to the opening. I think Koski and Chowdhury were also able to make it there. I agree with you that being able to bring services in the community is important. When I first got here in the first month, I was able to tour 311, and that was one of the things that they talked about, that they could see that there were folks who come downtown a lot of times, and it would be great to get out in the community. And that's why it was so important for us to have 311 have a presence at that location and be a main tenant there every day. So it's great to have them at the Lake Street Community Safety Center. We continue in OCS to plan for 2025, and all of our departments are doing that as well. As you know, we've completed all of our budget presentations to council, just like all the other departments. In the area of implementing the settlement agreement, we continue to do that. And for some of you, I've talked about this. As we head into trying to complete negotiations to have a consent decree by the end of this year, all of this work for compliance really is coming under the Office of Community Safety, and we'll be leading that work as we move in that area. We had Alifa, our independent evaluator, in town just last week, Wednesday and Thursday, for some community events. As you know, they shared with the community what their evaluation process is and talking about how will evaluate us. Our staff was able to record those meetings for Alifa, and we'll provide those recordings so Alifa can have that on their website. As we move into 2025 and strategic planning for the Office of Community Safety, of course, the work will continue with the 3 items that you see here listed. Of course, we'll continue to implement the Minneapolis Safe and Thriving Community Report. As you know, that is a 10-year plan. We will also continue our work in implementing and evaluating the work that we need to do under the settlement agreement that we have with the Human Rights Department of the state. One of the things that is important for our office is that, as all of you know, community safety doesn't lie just in our 5 departments. We have to continue to break down silos. We have to continue to try to partner and collaborate, not just with our other city departments, but also with the county and the state as well. And that is also a strategic priority for us that will continue into 2025. I'm going to stop there. Director Amanda Harrington will give her update on safety design and implementation. Thank you.
Thank you, Commissioner. Welcome up, Director Harrington.
Good afternoon. Amanda Harrington, Director of Community Safety Design and Implementation. My remarks today will be brief because you'll be hearing from me more extensively later on in the agenda. But to highlight some of the work that has been done in Q4, as has already been mentioned, we were able to open the Lake Street Safety Center, which feels great to have a win for everybody, something open in the community. We also began meeting with the design firm Wald that was selected for the South Minneapolis Community Safety Center. So design work begins on the larger project. We continue to work on pilots, including the embedded social worker pilot in 911 and having safety ambassadors in 2 cultural districts next year, as well as the juvenile deflection pilot that goes along with increasing clarity on the criteria for juvenile diversion. They really go hand in hand. And we've also begun work on some of the recommendations from the policing project. I know you haven't heard the presentation yet from NYU's policing project, but since we have been working with them regularly over the past year, just wanting to know we didn't wait until the final report was done to begin this work. So we've already started clarifying juvenile diversion criteria, as I mentioned. We've been meeting to discuss expansion of behavioral crisis response call types and increasing evaluation criteria for violence interrupters. You can see that in the current RFPs that have been issued for violence interrupters. There's a lot more success metrics built into that. We had an initial meeting with Behavioral Crisis Response, Canopy Roots, and EMS to discuss their process for responding when BCR is in the field and calls for EMS support. And we have begun meeting with Canopy Roots to discuss facilitating follow-up care when they respond to BCR calls. Looking ahead to next quarter, we will continue to do work with the Safe and Thriving Communities report, specifically with Phase 1 activities. So city staff need to do better communicating to the community and to city staff about the work that we're doing. And so we will be implementing the communications and engagement plan that we've created. We will begin an MSTAT that focuses on non-police responsive services and continue to catalog the safety services that the city currently funds or provides, as well as developing cross-departmental meetings to explore further collaboration that will be digging into data, discussing and norming collaboration between departments, as well as other issues that come up in safe and thriving communities. And we'll continue to work with IT on the phased technology modernization plan and hopefully have a community advisory group started. While we've been working with the policing project on the analysis for the past year, their work with us will shift to implementing some of their recommendations. And we do hope to have the safety ambassador pilot starting in the spring of 2025. That RFP will be coming out in the next few weeks. That gives us time to receive responses, select vendors, and get them trained up and on the streets in the spring, as well as ongoing design for the South Minneapolis Community Safety Center. And next, I will pass it on to the police department.
Welcome up, Chief.
Chair, thank you. Good afternoon. Fourth quarter highlights. One thing that's been recent is a partnership with the NAACP. How that came about was I brought in the NAACP to meet with the entire command staff at our ComStat meeting and to really go through and explain processes and how the police department tracks problems and crimes, both with the command staff of the police department as well as all of the embedded social workers, all of the community navigators, and our crime prevention specialists. And then what we came away with from that meeting is an offer from the NAACP to have them as an added resource to help mediate disputes. And we met with them again yesterday morning. As we started to go through the data that we have, we created a working committee just to try and identify as best we can from literally probably more than 2,000 calls a year that we have related to neighbor disputes, which ones are most appropriate to refer to the NAACP. And as of this time, I know we referred one dispute to them that came out of the 4th precinct. And I know they're just starting to work through that. So that's something that was generated by the NAACP through the Unity Community Mediation Team, and it furthers, the ongoing work that the department has with those community groups. As we know, Alifa was here last week holding two different community meetings. The MPD supported that, but not officially there as part of the meeting. We had our folks and inspectors getting the word out to people in community. And it goes in line with the work that we're doing every day with Alifa. I hold a weekly meeting with my team and Alifa that happened this morning for this week, and we go through it's kind of like a ComStat over all of the different parts of the agreement that affect the police department. And it gives a status update each week so that we can make sure that we're all on the same page, particularly as the goals go with the first year of the agreement. March 17th will be the anniversary of the first year when the majority of things are due. And that is helping to ensure that we're on the right track and able to quickly address problems. And then they've been very helpful in providing guidance and support as we do that work going forward. Last month, we had a Blue Mass at the Basilica of St. Mary. Blue Mass is something that is popular on the East Coast, particularly in the Northeast cities with law enforcement. As we had a police officer killed in the line of duty this year, we use this as an opportunity to implement this here. And in addition to that, we invited families of loved ones who were killed over the last 2 years in greater Minnesota and western Wisconsin. And then in addition, we've been trying, over the last 2 years, we've been trying to reach out to loved ones who have been disconnected from the police department. Some of them, their family members, their father, their brother, and others died serving the city many decades ago. And we actually had families there that had not been connected to the city of Minneapolis for several years, going all the way back to one officer that was killed in 1944 was there for it. So it was a positive experience, both for the people from the community that were there, but also particularly for the family members of the loved ones. And I know, having gone to way too many funerals over the last 25 years, one thing I've consistently always heard is children and loved ones have a fear that they will be forgotten. So we want to make sure that the loved ones from even decades ago know that we are not going to forget about them. The training division, thankfully we were able to hire our first civilian director of training. He's a PhD, worked at a college here in Minnesota, but he's also previously a police officer in Minneapolis for a number of years, so has kind of a unique skill set and has definitely hit the ground running, and we're very happy with how that is playing out. The training needs assessment was completed, and the 2025 police training needs based on the 10 focus groups that was internally conducted in the department, and there is a training plan for 2025 that's been completed and has been submitted to Alifa for feedback. We are in the process of conducting in this quarter 2 days of 16 hours total of use of force training. That is informed by what is in the MDHR agreement, but it is not the MDHR training. That's being conducted in light of what will be the policy, but it's specifically to complete what is mandated by post right now. I anticipate that next year we will again be conducting use of force training. That will be one additional day. So I expect to have 2 8-hour days, 16 hours for MDHR-related use of force training, as well as one additional day for 8 hours of training regarding use of force that's mandated by post. And we've been through the process of securing vendors for trainings in 2025 with all of the major areas covered by the MDHR agreement. We held a CSO welcoming ceremony as well last month. As you know, we've gotten a significant increase in the numbers of applications in our department. I couldn't be any more thankful for how that has played out. This is just a start. I plan on holding a welcoming ceremony at the beginning of January, where I anticipate we're probably going to have about 50 new hires. None of them will be immediately able to go into the police academy, About half of them will be people who are cadets. They have bachelor's and master's degrees. They have to go through 8 months of skills training, and then the remainder will be going into the CSO program, where they'll be going to community college for 2 years and then the police academy. So next year, we will be seeing a very, very significant turnaround, and we'll start to see the results of the recruiting efforts that we've had. So how that's been happening is that the process has been somewhat streamlined, and frankly, we've gotten a little bit more authority for our own recruiters to, reach out to candidates and keep them engaged during the entire process, and have people throughout the police department that are also making those calls and assisting our recruiting team. Because the reality is we have to constantly connect with these folks and give them help along the way if we want them to come and work here. The process can be very long, especially for young people from the city that are not familiar with it, that do not have the college that's needed before they can go to the academy. It can be several months and even close to a year at times before they're actually able to be hired and start their schooling. So I just want to make sure that we continue to do a better job at engaging these folks and helping them along the way. There's eSoft, which is a new software to help for background investigations. We think that'll significantly cut down the time it takes to do both sworn and civilian background investigations for the city, and I hope to have that implemented within 1 month. We've also expanded our program to use interns as a placeholder so that we don't lose these kids before they go elsewhere. We have the ability to hire young people as interns to prevent them from taking a job somewhere else before their college course starts, and they can then begin the CSO program. And the implementation unit is the unit that does the work around reform, around ALIFA. They've created training regarding immigration policy, T visa, U visa, for all our academy classes and for the precincts. We will be starting a Latino community academy, hopefully early next year. We rewrote and submitted for community feedback the stop, search, and arrest policies, and I believe they will be posted for public feedback very soon. They're going to the monitor this week for their review. We've also submitted force policies to ALIFA and to MDHR for their compliance review, and I know they have a meeting for several hours on Friday of this week to hopefully wrap that up. And that's it for police.
Thank you, Chief. And what I'll just do is, because it is a long presentation, we'll first open up the queue for our colleagues to be able to ask potential questions, comment, not just for your department, Chief O'Hara, but there was 3 presentations from OCS, Safety Design and Implementation, and then MPD. So if our colleagues have any questions regarding the first 3 components of this, please get on queue, and then after that we'll proceed onto the presentation, just so we can make sure people are able to comment. So first call on President Payne.
Thank you, Chair Chavez. After the Davis shooting, I actually had a resident reach out to me that weekend who I tried to work with them probably a year and a half ago because they were kind of in a similar dispute with a neighbor. I kind of ended up in a similar situation to Councilmember Jenkins in that there just wasn't a great response. In this case, I don't think the threat of violence was as much a component of the harassment, but it still feels like my resident felt very unsafe, and just seeing the news kind of triggered that for her, and she reached back out to me, and it was just very ironic that week I'd been talking to the mayor about this need for some sort of mediation service, and then that tragedy happened. I was really actually kind of got my ears perked up when I saw that you were working with the NAACP around this need and this gap. I'm wondering where we're at in the program design of that, and because literally I just this week sent information to my inspector with all of the information so he can follow up, but I don't know that that's the right follow up. So how do we actually start using this new mediation service?
Yeah. Thank you, Chair. Thank you, Council President. So before all this is something that the NAACP does, and probably a month before all this, they had a referral. Assistant Chief Gators was involved with it. It was somewhere in Northeast, but again, a similar issue. So this is something they already have expertise at. And my purpose of bringing the whole command staff in, bringing the social workers in, the navigators, the crime prevention specialists, is because everyone is touching some piece of this problem, and we get a better understanding for the system and the issues with the system when everybody's in the same room. And so that is being worked out, and we are going through, like I said, we are going through data to analyze, like the 2,000 call this year, how many are repeat calls, what is appropriate, though, to be referring to them. They're not going out places where, there is a potential for violence. So, I am really, really hopeful as we move forward, but it's work that's ongoing, that we're just going to keep going and figure it out as we move forward and make adjustments. But I'm really, really thankful that they've been so willing to volunteer their time and to meet with us and to continue to push through this.
Can you follow up with Inspector Torberg? He has all the information, and I think the case that I'm trying to help with my constituent would be a very good test case for this.
Is this, Chair, Council President, is this near the high school?
Yes.
Yes, I'm aware.
Okay.
Yep. And I think as we go forward, the inspectors are going to have to be the quarterbacks of these issues, because they're the ones that have access to all the other different points.
Mm-hmm.
So that was, I didn't answer that part of your question, but that's what we're thinking. Yep.
It's great to hear that you're already kind of looped in.
Yep.
My other
Near
question...
Edison, right? Edison High School, right?
Yeah.
Yep.
My other question is around training. So we just, in agenda setting, got some updates on some training that's going to be coming forward in response to the settlement agreement. Mm-hmm. I also don't sit on the AO committee, but I know that there was a letter of agreement, or maybe a few letters of agreement that were being considered. Mm-hmm. I think it got forwarded without recommendation. I'm trying to keep up with all the things that I'm actually not always a part of. And for me, as we go back to the idea of the last contract, one of the big things that we tried to do was get all of those disparate letters of agreement and get them under one contract, and that was one of the bigger components to that contract. Now, as we have another letter of agreement or series of agreements being considered, I'm trying to put this into that bigger perspective on how we're managing these things holistically. And I'm also looking at a letter of agreement as still a labor negotiation. And does that letter of agreement, which, my apologies, I haven't sat down and read the RCA, does that have any provisions in it associated with training? So I believe there's one that's associated with overtime.
Yes.
But like that's in a negotiation, there's usually a quid pro quo. Was there any quid pro quo in that letter of agreement? And if not, is there an opportunity to bolster some of our efforts around settlement agreement as we go into these letters of agreement?
Yep. Chair, thank you, Council President. Director of Labor Relations did respond at that meeting. I don't want to contradict her, but my understanding of this is, so there's two letters of agreements. One is the vacation time extension. The other is the extension of critical staffing overtime. And both essentially are just necessary because the staffing, continues to remain so low. I don't recall the answer to what was addressed in negotiations, and I wasn't there. I know she did respond to that. But yeah, that's the best I can say about that. And the other trouble is, we need to do more than just the minimum of MDHR required training. And we're really, it's going to get worse next year before it gets better, only because we're going to have, God willing, we should have a lot of people to train. So that's going to require, it's not just adding this new MDHR stuff. I'm hopeful we'll have, 50 recruits or more in the June Academy, which we may need to have a daytime academy and a nighttime academy. But the only way to get through this stuff is to push forward. And every time we take people away to help train or to go to new training, it just causes another hole someplace else. So No good answer, unfortunately, but it just, the vacation stuff is stuff that's been accumulated over time, and the overtime stuff is just reflecting, again, we have not improved, staffing on the street, but hopefully by the end of this year, I'm confident, that'll be different.
I think it would be very beneficial between now and, we kind of have an extra week in between to maybe me, you, and our labor relations to get on
Sure.
Teams. And I have some ideas
Yep.
before we get to that final vote
Sure.
that I think might be beneficial.
Yes, Chair, thank you.
Thank you.
Thank you.
All right, thank you. Next up, we have Vice Chair Wansley.
Thank you, Chair Chavez. Actually, my first question is for Commissioner Barnett, and it's actually somewhat tied to points raised by Council President Payne in regards to the question we had around overtime and staffing and AO. I wanted to know, what is the status update on the staffing study? I asked this question to Chief O'Hara, but wasn't able to get a concrete answer. And I think it's important, especially if we're going to constantly keep pouring money into overtime. And we're getting a presentation later on where it's letting us know we were able to divert about 10% of calls away from MPD, and we have the ability to divert about 47% more. So that means we could be investing in other components of our safety workforce that could then take away, again, $14 million that we're about to pay in overtime now, and expand our workforce. That means also we're making sure we're not overworking our already exhausted MPD staffing, and making sure we're not putting them in this predicament that I raised on Monday, where they're either they are overworked, which create this condition where either they're going to be a liability to themselves through PTSD claims, or then potential misconduct can happen with civilians. So either we're in this dynamic where we've been in for several years of paying multi-million-dollar settlements. So I'm interested to know, what is the status update? We've been asking for this, or I've been asking for this for several months now, and it's just been kicked down the road time and time again. And it would be very good to know kind of where we're at, because we keep hearing about staffing challenges, and that report could actually help us understand in our current predicament right now, with social workers being added to MPD, with BCR being added to this office, with violence interrupters being added, and several hundred civilian staff being added to MPD as well. What is the holistic picture that we have when it comes to staffing resources that's helping us reach historic levels of crime that we haven't seen, even when we were at closer to 800 level of authorized, MPD officers on the streets? So I just want to get a sense of where are we at with that staffing study first.
Chair Chavez, Council Member Wansley, I will have to check on that for you. That wasn't a question that I anticipated for the update today. So I will check and see where that legislative directive is and when we can report back to you.
Clerks, if you can, once again, get an update on the staffing study. Ideally, we will get that by next year. Also, if you could share any information about the larger picture about just public safety workers that's providing services alongside MPD responses to 911 calls. And I'm thinking more so an example of this, for instance, on a Friday night, in addition to MPD staffing, basically how many violence interrupters do we have on the streets, or BCR? And this is likely, again, why I want the staffing study, to get a sense on every single day. We're always hearing about how many, or the lack thereof, of officers we have on a day-to-day basis. But how many do we have of the other safety services that are filling in the gaps? We don't often hear that piece. So it would be great to hear the totality of our entire safety kind of workforce portfolio, even including fire, which we often underhear about. So it would be great if we could get a portfolio or snapshot of that. And I think you did somewhat of that earlier this year when you all gave us, I believe it was precinct by precinct breakdowns, which were phenomenal to have, great comprehensive data to have. And I hope we can restate that going into next year. So if we could get that information, because it's often unclear and for my residents who often hear, are these other staff positions doing anything. And I'm like, they're actually working pretty hard. So it would be great if there's a way to get an aggregate figure of year to date. And I know Vicki was able to do that on Monday, where she was able to just, tout out hours of MPD, working Monday through Friday. If we could do that with all those other, and I could send that to you, Rachel, too, that question. And then next, this question is actually for Director Harrington.
So just for clarification, Chair Chavez, Chair Wansley, are you asking a snapshot of a day in who's out there citywide? Is that what the folks that we contract with?
If there's a way to do year to date, because it would be great to see also seasonally, of winter, summer, where are we at? Because again, we don't often see that at all. And we've been asking of that from NSD too, and that's kind of getting at the presentation that we're going to get later today too. But seeing where are the resources being kind of dispatched collectively. Again, we mostly hear about MPD; they're covered, but everyone else not so much.
Chair Chavez, Councilmember Wansley, I think what you'll hear from the representatives from NYU Policing Project is that we have these services, and it's really about coordinating a lot of the services. Director Amanda Harrington has been doing a lot of work with trying to map out with the services and where people are. So we'll do our best to answer your question with the data that we have. But that's one of the things that we're trying to get at with collecting data and understanding, to your point of where do we have people deployed outside of our police department. So,
and
yes.
I'll reserve questions from there, but even just knowing from our RFPs, we do have teams that we bake into our violence interrupters. So knowing we're paying for a certain amount of teams to be out at certain shifts per week. So even based off of that, and our, what we pay for now, we should be able to make an estimate.
Right.
Yeah.
Okay.
And then next, Director Harrington. I wanted to go back to slide 7. Just you mentioned the piece of the evaluation criteria for violence interrupters, and I just wanted to know if you could share a little bit more about that. I know I got contacted with just some of concerns around if that was the parameters of the requirement of a bachelor's degree now, but I just wanted to get more context on what the criteria piece was.
Chair Chavez, Vice Chair Wansley, I wasn't actually speaking about the criteria for the request for proposal that was drafted in neighborhood safety.
Okay.
What I was referring to was the success metrics. So as we are gathering data from vendors about how many people they see, how many are actually connected to longer-term resources, those are things that we're trying to implement more of from the front end as we contract with our safety vendors.
Awesome. Thank you so much. And sorry, Chief O'Hara, no, I made you just sat down, but I need you to come right back on up. Thank you. So I had a couple questions also related to just the mediation partnership, just trying to figure out the process on how you were able to do this piece. So I know in working with NSD a lot, there's so many guardrails put in place in terms of how they're able to enter into partnerships. Largely, the city attorney's office is always saying they can't directly enter into a direct partnership with the organization without going through an RFP. So I'm trying to figure out how are you able to enter into a partnership with them directly without doing an RFP or working with NSD to do mediation, because essentially that's would be in their restorative service division.
Sure.
Yeah.
Thank you, Chair. Thank you, Vice Chair. We have an ongoing relationship with the NAACP, with Unity Community Mediation Team. We meet with folks regularly. This is something that naturally arose from that, and it's something that the community is offering to provide us and to work with us doing. In terms of RFP, there is no city funding that I'm aware of that goes towards any of this. This is completely, community initiated, folks being willing to spend their time helping us to resolve a community problem. Not to say that it should not have funding, but that's how this happened.
Have they shared how they're going to be able to like stand this up? Because I know in the NAACP, one of the things that they have always had to contend with is it's a volunteer-led organization, and they do basically full-time work. So, and that's without mediation work. So I'm interested in how they're going to be able to like pull this off too. Yeah.
Chair, Vice Chair, I would let President Cynthia Wilson speak for herself, but it's my understanding, she's already getting sometimes dozens and dozens of calls for assistance and different things. This is one area that they do get calls on already, directly from the community. Okay. And it's something that they already do on their own. It's just opening up MPD as a pathway to try and help resolve some of this.
Okay, and then do you know if there is any openness for like data sharing in this? I mean, of course, I can imagine because we had a situation here in PHS, for instance, with the Unity mediation team in terms of supporting the complaints for CCPO. And originally they were doing that also, volunteer based and pro bono, but of course, like, for extended period of time, it's like, okay, we want to be able to be compensated and presented a request. So I'm just anticipating that might be the situation. So that said, do you know, like, if they have data sharing, like, openness, like if PMI can be involved so we can be able to track, like, how many requests they've been able to service in the community, so that if they could come forward, we could confidently say, oh, yeah, they've been a phenomenal partner in this work.
Yep. So, Chair, Vice Chair, part of the working group, I'm going to be receiving documentation both from Unity Community Mediation Team and from NAACP as far as what their plan is. Once I have all of that, I'm going to put that into a plan in the department and then work it out with both organizations, like how are we going to implement this, how are we going to track it going forward. So they will have their method of tracking things once we get referrals, but I want to make sure that we are tracking things also. So we'll have data that will be available, and then they'll have data based on their results. And it is tied into, you mentioned the sites for Unity Community Mediation Team. This is a part of that because the intention is to have those sites be available as places where community can go for mediation based on, what community this is coming from, wherever the problem is. So it is connected to those sites also.
So one thing on that one that I will flag, I don't know if Alifa has been part of that, because one thing that came up on that piece is, from my understanding, the settlement agreement recommended complaint-based sites. And they're doing something different of they're trying to mediate and resolve, and there's a place for that. But there's also a need for complaints. Those are two separate things. Yep. And so not wanting to see those be conflated. So I don't know in terms of how you all are moving that piece forward of making it clear there's a boundary there of if they want to do mediation-based work, they should move forward with that. But then there needs to be a process, maybe that civil rights led, for just doing complaints.
Chair, Vice Chair, MPD will not be present for these mediations. And they're their sites, frankly. They're not ours.
Well,
we're not going to be there.
You should look at that presentation because they mentioned one of the mediations they brought to you and were able to resolve it directly with the police, which was concerning.
Chair and Vice Chair, different type of mediation, I would say, than what we're talking about here.
Okay.
Yeah. I would say more correcting a misunderstanding.
All right, then. Well, yeah, definitely look forward to hopefully getting more information on that. In terms of the legislative directive, I could see that fitting into, if we're doing anything around mediation services, hopefully that factors into it. On slide 16, you mentioned a list of the trainings again. I wanted to get a sense of if you all are incorporating anything around refreshers on hate crimes in light of the Maturi shooting and also the uptick in targetings of mosques and synagogues. I know this was a matter that we had to deal with about 2 years ago where we learned actually MPD was not seeking out hate crime training and civil rights had to use their budget to provide that. So we just wanted to see if that's ongoing or if there's any refreshers or updates happening.
Chair and Vice Chair, yes, part of the training protocol calls for implicit bias, race-based policing training, and that's, part of the overall plan, as well as ongoing, I have held meetings with imams, I have held meetings with JCRC and some of the folks from the Jewish community here at the university also, as these issues have arisen, and we have given direct roll call training at times, when things have been heightened.
Awesome. That's all the questions I had, Chair. Thanks.
Thank you, Vice Chair. Next up, we have Councilmember Palmisano.
Hi there. I'm not sure whether this kind of a question would be most appropriate for the chief or the commissioner, but I will say I'm super excited about Dr. Williams as the new head of training. What a unique assignment to be able to have as a former officer himself. And I'm curious, this continues to come up in conversations amongst different first responders. Training presents so many challenges for you, and I have an appreciation of that with what little I know. But from what you said in this presentation, there's people coming from all different backgrounds. There's an incredible amount of legal knowledge that people have to have, just really rooted in their brains. There's a lot of physical training. There's a lot of new skills to develop, de-escalation, just to name a few of this policy manual that I don't think I would ever be capable of learning. But another aspect of responding to emergencies well and swiftly is how MPD interacts with other responders on scene, whether that's EMS or fire, or even our BCR team or social workers that might be with them. And I know this has to, at times, coordination with absolute strangers that all happen to end up in the same place at the same time is critical. A great benefit of some of the training centers I've seen around Minnesota is the interdisciplinary nature of them. And we don't have that. To my knowledge, we don't have that. And we just renewed a contract to stay where we've been. Often, not always, and I'm not sure I have this exactly right, there needs to be a medical director assigned to our city in this way. And I'm curious, have you ever worked with one? I don't know if we need one or not, but we've had issues that have come up in the past. The ketamine situation was probably the most visible of them in my tenure here. But is there value from your perspective in having such a thing, in having a medical director on board, and how might we have one in our safety ecosystem? And that's not just for police, it's police, fire, all the ways that we respond.
Chair, council member, thank you. I know I found out while I was here that we did not have one. But I believe the fire department does, and I think we were in the process of trying to have that person also serve as our medical director. It affects things in different ways. Obviously, personnel from the fire department that are functioning as paramedics need a medical director. But the same is true on the police side. If we have folks who are trained as paramedics, they need to technically be under a medical director if they're going to use that training. So I know I found out within the last year that we did not have one. I'm not certain if that was ever resolved. I just don't recall offhand, but I believe the fire department does have one.
So, and I'm just thinking out loud here, would it make sense for our city to maybe have one medical director that's coordinating this, and so that everybody's on the same page, right? Like, I want our fire department and our police department and our BCR response to be working hand in hand, and I think most of the time they do.
They do.
But in all of the training that we are already giving to particularly new officers as they come on board, I think that interdisciplinary aspect is really important.
Yep.
And so I guess I would just say I really encourage that we figure out our medical director around here. Thank you.
Thank you.
Thank you. Next up, we have Councilmember Rainville.
Thank you. Chief, since you're up there, I'll get you first. First of all, thank you for coming last night over to the Urban League for the Unity Community event. That was really nice, and you could see how much the people respect you and the force. It was great. And to bring the CSOs there was a really good touch, to let them know this is the community that they'll be serving and allow for that relationship building. Thank you for that. And the recruiting is incredible, what you're forecasting as far as how the force will grow next year. So that's really a glimpse of hope there. But you also mentioned that to train not only existing officers but new recruits, it's in essence going to have an effect on the 911 response because we're taking bodies out of service. Is that true?
Chair, council member, yes. There will be a dramatic turnaround next year. It will be dramatic. Like I said, I expect to hire 50 new hires just in January alone. So I don't think it's unrealistic to think we could potentially hire 200 people next year. The problem is, I already know from people that will be either are right now or will be employees in January that we're going to have at least 30 people already feeding into the June class from people who are CSOs now or have agreed to take job offers as cadets in January. So we know from past experience here in 2019 and before, the academy was overwhelmed, the staff that existed then, when classes got significantly larger than what we currently have. So it takes people to do all these trainings. You have to have instructors that are properly trained. It takes properly trained field training officers to train them when they graduate and get them out in the street. So it is, again, it's critically low right now. And then, like I mentioned, for every hour of new training we're implementing for MDHR, it's one less hour that every cop is available to be on the street. So I recognize it is a challenge for the department, and I hear it every day from folks in the department, and I get it. But it's something that we're going to push through because at the end of this, that's the way to have a solution. At the end of next year, to have a significant increase in sworn personnel is what will provide residents and the cops some relief.
Okay, thank you. It's good news and bad news. The good news is there's going to be more 911 patrol, but the bad news is it's going to be a struggle to get there. Yeah. Okay. And my last comment is I was really surprised at your information that there's about 2,000 neighborhood dispute calls a year. That's about 6 a day. Mm-hmm. And so congratulations on the work to work with the community, to have them volunteer to get involved with that. That'll take a lot of load off the police department as well.
Yeah.
So you're doing a great job. Thank you.
You.
The next question I have is for Director Harrington.
Welcome up, Director.
Just one question for you, Director. In your presentation, you talked about considering expanding BCR eligible call types. Do you see some future with that? Again, as I mentioned, the chief, his work to take these mediation off the police, the neighborhood disputes off the police. Is this another opportunity to lessen the call load?
Chair Chavez, Councilmember Rainville, this actually recommendation is aligned with the recommendations that we have from NYU's policing project, in that we are striving to increase the number of expanded response options so that we always have the right response at the right time, and sometimes the right response is a mental health provider. What exactly the call codes are that they might respond to is still a point of discussion at this time. I'm not sure that I could name for you the call codes that we've been discussing so far, but it may include neighbor disputes, or it may not. We may need to find a different response that's not mental health professionals to respond to something like that.
Great, thank you. That's wonderful, thank you. And last, Commissioner Barnett, I know you have to leave, so I'm going to be very brief. But as we wrap the year up, you've done an incredible job. There is no one in the city enterprise that's second guessed more than you. And you handle that with grace and dignity. And thank you so much for your willingness to serve the citizens of Minneapolis. Thank you.
Thank you.
Awesome, thank you. I'm next on queue. So if we can go to page 16, specifically talking about the U visa component. So this would probably be for MPD, Chief O'Hara. So, or that's actually page 15. No, it is page 16, yeah. So it talks about create a U visa and T visa and MPD immigration policy, education materials for academy classes. That's really good. Thank you for doing that. I guess my question would be for you and probably the city attorney's office, because I believe the U visa program is both within the Minneapolis Police Department and also the city attorney's office has a component when it comes to this. What I'm trying to figure out is how many U visa applications were submitted this year, both from MPD and the city attorney's office. And then the second component was the certification. How many certifications how many folks are certified to get a U visa, both an MPD and U visa? So this question is kind of directed to both MPD and the city attorney's office, because I believe this program sits within two departments. Yep. And then what kind of engagement is done to educate the community on these programs, at least for MPD side. I know that I assume this education material is in hopes of increasing education of this program, but that's the first question I'd like to ask.
Yep. Thank you, Chair. So I could get you, I don't have them on me, but I could get you MPD's number, and I don't know if we're notified about the result.
Perfect.
I don't know.
Sweet. Thanks, Chief. So what I'll have note for administrative follow-up is if we can make sure that MPD provides the City Council with data from 2024 when it came to how many U visa applications were submitted to MPD. I'll add also the City Attorney's Office a different breakdown, because I think it matters which department people are going to. And then the second component, how many folks were certified. So, okay, thank you very much. I appreciate that.
And also, Chair, the second part of that, community engagement around that. So I know Inspector Gomez has done a lot. Members of the implementation unit have gone out to try and address that. And just last week, because we're getting some inquiries from some community groups, we put out a video in Spanish and in Somali to some of the community groups to try and ease some people's fears.
Thank you. And then, yeah, I appreciate that. I know the Hennepin County Attorney's Office also made some changes to their program, I believe, was it earlier this year or last year? And I guess the reason I'm asking these questions, I'd like to see how the program is working in the city and if there's need for change in case our numbers aren't, there is a big need in the community. And if there isn't many people looking for help from the city, then I feel like there is something we need to maybe address. So that's why I'm asking that question. And then the last question is in regards to, and it may be a flurry of questions, but its topic is about the NAACP partnership to mediate disputes. I guess my first question is for the city attorney's office, and I'll need some support in getting an answer from you, is can you explain to me, one thing my office gets a lot of emails about is property line disputes. Can you let the public and my office know what the role of the city council and what the role of city government, the municipal government in Minneapolis, any elected official is when it comes to property line disputes?
Mr. Chair, I would probably have to do a little bit of research on that. I think property line disputes among private property owners are usually best handled by those owners with a limited role for government. Of course, once threats start getting made or things start to escalate, there is an important role for local law enforcement and the government to take in those situations. I don't know if that answers your question, but I'm happy to follow up with you.
That would be very helpful. Thank you so much, Bert. I really appreciate it. The reason I'm asking is because there's been many instances that my office has received concerns about property line disputes, and whenever I reach out for help, it's oftentimes that's not the city's job, and that's not our role in city government to address those issues when it comes to property line disputes. And it leaves this feeling with many residents in our neighborhood, this feeling like their city council member does not care about them and that their city council member does not want to address the issue, and it can lead to a lot of issues. Now, my concern with that here is that I really want to know more information about what this partnership is. And if there is going to be mediation services provided to community members through the NAACP with a partnership with MPD, maybe it's a property line dispute. How are we doing that? Is there a program manual? Is there a FAQ sheet? Are we going to get into legal issues and problems that's going to end up the city being held liable for thousands and millions of dollars for potential lawsuits when we're now doing something that we have been discouraged, or we send residents into a direction saying, go find a lawyer and deal with your property line dispute a different direction. So I guess my question is more of, if we're not funding this partnership with the NAACP, but we did go to the media saying we're doing this program with the NAACP, we don't know how folks are going to participate in the program necessarily through this new partnership. Folks that have property line dispute issues are being told that that's not the role of city government. That's something we need to figure out a different way to address. Have you considered potential legal liabilities with this work? And if not, that's okay. What are we going to do to mitigate risk in the city enterprise with this program? And are we talking to civil rights? Are we talking to MDHR? How do we guarantee that when there is mediation that's happening with a partnership with the city, if something concerning does happen, I'm not saying it's going to, but if it does, then what is the role of city government in that instance? Because it's a partnership that we helped establish, if that makes sense.
Yep. Thank you, Chair. So again, this is something that people are already going directly to the NAACP about, not necessarily about property line disputes, but problems between neighbor to neighbor, tenant to tenant, that kind of thing. It would be completely voluntary on the part of both parties involved. So nobody's going to be forced to do this. And I have been in communication with MDHR, with the monitor, before we started to do this, and got very positive feedback from the monitor. So we do make a number of referrals in different ways now already, and there is mediation, I believe, through the city already that does exist. But this is just something that is community-based, that would have to be completely voluntary for folks to go through. And then, again, beyond that, we're still working through a lot of the details to ensure that it's tailored specifically to what the NAACP is trained to do. But it would not be something anyone would be forced into. Everybody involved would have to agree to participate, just as an added resource.
For sure. And I think this is still a partnership that the public now heard that exists. I think it's important for us to know if there's a program manual, because there's now a public declaration that there is a partnership with an organization who I respect a lot. But it doesn't mean I'm not going to ask questions, correct? Because there are concerns that I have when now there's a partnership that we have established that our constituents are possibly going to reach out to us how they access those services, because it's an official city program or some official city partnership that is now established. If there's an FAQ sheet that we can get, a program manual that we can help spread to our residents. I'd like to hear the opinions from the city attorney's office of if something happens, what our legal liability is, because now it's an official city partnership. I think I've had residents in my community ask me about what does community-based sites look like, and I also am taking a very careful approach with that too, because I don't want to create legal challenges for the city. I don't want to accidentally lead us to violating our consent decrees. So what we're doing is working with civil rights and the city attorney's office on getting answers on what we need to establish any community-based site that is city-led in Minneapolis, because I think it's important to spread awareness on how you can file police complaints in our city, specifically in communities of color who don't often trust the police. However, I feel like I need more information on how we got to this point, and if conversations happen with the Civil Rights Department, if conversations happen with the City Attorney's Office to establish this partnership, and what our legal liability is. So, yeah.
And Chair, this is both the sites and the use of being able to respond to crisis, community-based crisis, are two different provisions that are in the MOU that exists with the Unity Community Mediation Team, of which the NAACP is one of the organizations. So it is grounded in that legal document.
For sure.
Yep.
It's grounded, and that's still now a city service that we're offering. So once we get that program manual, how people can access it, and what it means for the city to have this form of partnership would be helpful for the body to understand. All right. I think that is all for you, Mr. Chief.
Right. Thank you.
Next up, we have, we're still going though, Emergency Management Department.
Good afternoon, Chair Chavez, Vice Chair Wansley, committee members. I am Rachel Sayer. I am the Director of the Emergency Management Department. As you know, our mission is to build, sustain, and improve our capability to prevent, mitigate against, prepare for, respond to, and recover from complex incidents and natural disasters. In Q4, our department undertook a series of activities, including we coordinated an enterprise-wide preparedness planning for the presidential election day. That is standard protocol. We convened over 12 departments across the city, as well as the parks departments and others, to make sure we were all on the same page in case there was any need to convene further response. We delivered a round of Ready Camp, which is our community engagement. This time it was held at the EOTF, and we'll talk more about that in Q1. We moved to level 3 situation monitoring for 3 different events. That means that our department is at the ready in case anything happens. That was for the Twin Cities Marathon, for a structural fire, and again for the election. We have conducted ongoing NIMS maintenance, so this includes training for ICS 300. That is a course that is offered for intermediate ICS across the city enterprise. We have colleagues from across all the departments attend that course if they may be involved in a response at all. We had several other trainings, we had several functional exercises, and we led tabletops for our different response sections. We also, this quarter, have been ensuring that our continuity of operation plans are up to date. We do that every single year, and our team runs exercises and tabletops for every department that has a continuity of operations plan. As we look ahead to Q1 for 2025, we are absolutely going to be continuing, as always, our NIMS maintenance, and that includes workshops, trainings, and it will include an enterprise exercise. We will continue our Ready Camp delivery. And again, that is the community-based information session over 2 days that is open to the public. We are going to be preparing for a renter and homeowner insurance awareness campaign. This is an item that was part of the 2020 After Action Review, so we are rolling out that information. We will be participating in the Community Connections Conference, and we are going to be embarking upon the very beginning of vulnerability assessment stock taking. That is it for me.
Thank you. Welcome.
Good afternoon, Mr. Chair, members of the committee. My name is Luke Scardili. I'm the Finance Director for the Fire Department. Thank you for allowing me to present Fire's quarterly report today. The mission of the Fire Department, employees of the Minneapolis Fire Department are thoroughly trained and ready to protect lives, property, and the environment by rapidly responding to emergencies and hazardous conditions. We are committed to prevention by proactively working with the community to reduce risk to life, property, and the environment. And our motto is serving the community, enriching the city. Our Q4 highlights, we just recently conducted a fire investigator promotional exam. Work has begun to expand the Safe Stations opioid peer recovery program to a second station, Station 7. This is a program that is also grant funded by the Department of Justice. And we just recently celebrated and highlighted accomplishments of both firefighters and civilians at our annual Fire Department Awards ceremony. Looking ahead to Q1 of next year, the launch of that Safe Station program expansion into Fire Station 7 is set for early January, the first week of January next year. We have a class of fire cadets that are going to graduate also in January of next year. And then we will be conducting another Fire Department EMS Pathways Academy starting at the end of Q1 in March. And that is all for the Fire Department.
Thank you so much. Next up, we have Neighborhood Safety Department. We're just going to do 3. Yeah. And then after that, we'll open it up for questions.
Little tall there. Good afternoon. All right, Neighborhood Safety Department. As you know, we use public health approaches to help reduce the impact of violence on our communities. We work best through the building of relationships and building community. And we build and operate versions of evidence-informed strategies and best practices, partnering with local community-based organizations to develop and operate innovative, community-driven prevention strategies. A quick highlight that we'll go through very quick. It's important to note for us in Q4 that this is the first quarter that we started working with newer contracts and not amended contracts. So as we were working with amended contracts, we had some limitations in geography that were specifically listed in those contracts. Now we're at the point where we are moving forward with new RFPs and new contracts, which gives us an opportunity to incorporate some new innovations from lessons learned from the previous. Oh, I just said that. Some of the priorities and highlights from Q4 that came from those lessons learned really was around continuous improvements for future contracts and versions of oversight. So we worked really hard on improving our RFP development process, tailoring our contract terms to specifically fit the issues that our boots on the ground were seeing. Evaluation process, we improved with our RFP evaluation. We moved to a stronger collaborative practice model with other agencies and departments, other departments in the city and agencies that we collaborate with. We improved our oversight enhancements and updated our budgeting and reimbursement and reporting requirements. So to dive into that a little bit deeper, give you a few examples. We now are leaning very heavily on collaboration with our national technical partners who are assisting us with developing the RFPs as we roll them out this quarter and moving into 2025. And we are also including customized terms that now reflect a better project scope, mitigate risks, and ensure legal compliance with the help of City Attorney's Office. We are now conducting pre-evaluation meetings and training to ensure standardized evaluation practices. We are also hosting meetings so that applicants can ask questions ahead of time and get clarity prior to submitting their applications. We are randomizing reviewer assignments rather than having reviewers select which applications to review based on their choice. All reviewers now review the same applications, and we have mandatory debriefings as our capacity allows, so that we can build trust with applicants whether they were awarded a contract or not. We also have now the active involvement of the city's grant and legal teams to ensure compliance with relevant state, federal, and city policies, and we are collaborating heavily with procurement to ensure evaluation consistency and best practices. Some of the other highlights for quarter four were focused on our newer budgeting priorities or budgeting allocations, including the allocation of the $3 million one-time general fund dollars for cultural safety ambassadors to provide capacity to implement an ambassador pilot program in the city's seven cultural districts. In quarter four, we started working on that plan, and will be contracting with a community organization or organizations to provide ambassador services, which will focus on hospitality and supplemental safety. That RFP will be released November 26th, and there will be 2 pre-proposal meetings that I just talked about where applicants can get clarity on December 5th, both at 10:30 and repeated again at 11:30. The collaborative public safety strategy invested $600,000 in collaborative community-driven public safety strategies in North and South Minneapolis. We're beginning to initiate phase 1 of this project in collaboration with Chair Chavez's office, leveraging the existing Blueprint Institute program to reach initial goals of this project. The Elliott Park Community Safety Initiative, which approved $200,000 to conduct community safety initiatives in these areas. The work has begun on this initiative. One of our funded programs was already known to the area and had deep relationships in the area and have actually received positive feedback. I believe it was the very first day that they were doing work in the area, they mitigated a dispute, actually a neighborhood dispute with a homeowner that involved a firearm. So we are already seeing positive results with that initiative. Lake Street Public Safety Coordinator pilot. We recently awarded a vendor a contract to coordinate this pilot, and with transit safety coordinators, we're working with Councilmember Chowdhury's office in plan development and coordination. Phase 1 of this program will include the hiring of an FTE for coordination. Other highlights, we released RFPs for the following prevention measures, GVI and YGVI. Those applications have been received. We will see new vendors that be awarded in April of 25. And the Minneapolis Violence Interrupter Program, that RFP is open now. Really excited about this one because we are getting such strong support from Cure Violence Global, which I believe Council knows created the violence interrupter model and is the foremost expert in this area. If organizations are interested, check the website, that's open now, and we will expect to have new vendors April 2025. And then we recently awarded 12 vendors across the city to do community trauma response work, which is restoration work with survivors of crime. We also, following a few particularly violent incidents in the downtown area, received information from some of our boots on the ground that many members of the city converge downtown from areas that they work. So taking their lead and taking their advice, we developed an emergency community response downtown just to pilot for 2 weekends. But our boots on the ground tell us that it's been successful not only in mitigating some of the efforts downtown, but also mitigating efforts in other areas of the city. And I believe this is the first time this has been a combined response between preventative response and restoration services, and that work continues. A quick look ahead to 2025, we're continuing to work, aligning our work with the Safe and Thriving Communities report. We are enhancing the use of data to prioritize our core programs, developing a communications plan. I was really happy to hear Vice Chair Wansley mention how we don't hear a whole lot from some of our boots on the ground, and that communications plan will include that. Developing plans to improve our collaboration with other government agencies and community members by continuing our bi-weekly meetings that we hold jointly with OCS. Those include members from Metro Transit, the Park Board, and Hennepin County, and others, and continuing our weekly meetings with our currently funded vendors. We're also investing in some data collection improvement systems. One of the most recent that we begun work with is with members from Harvard who are assisting us with a study on data collection improvement for behavioral crisis response. And we are building contract monitoring competencies.
Thank you. And now we're going to open it up to questions before we go into 911.
Sorry.
No, thank you. So first up, we have Vice Chair Wansley.
Thank you, Chair Chavez. In regards to some of the contract, the contract slide, which I believe is on 29 or 2930. I wanted to know, have we also decided to eliminate the provision around direct client services? I know that has been something that has allowed our contractors to better serve our residents, especially Black and brown residents who are often in contact or most likely prone to being involved in group violence. I know this is something that the county and other state agencies don't eliminate. So I've heard that that's something that we're doing. So I just want to get confirmation if that is something we've eliminated.
Yeah. Thank you, Vice Chair Wansley, for that question. And I debated whether or not to put that on the slide because it is definitely something that I believe council and our departments should have a discussion around as we move into 2025. So client assistance services, we hear overwhelmingly from our boots on the ground, and I know from my own knowledge working in victim services is extremely important in this work, particularly with communities of color and other marginalized communities. It is the work that brings people to a place of stabilization, which is exactly what we see both with perpetrators and with survivors who are sometimes both, right? ARPA funds allowed us to use those client assistance, do those client assistance services freely. What the department has been notified of is that there is a discrepancy with client assistance funds and public purpose. So we are now in discussions trying to figure out mitigation strategies to eliminate not having to take those out of the contracts. As of today, November 18th, 20th, they are not in contracts, those client assistants, not the new ones. They continue to be in the current ones. So we're really going to see the impact of this right around March of 2025. We're doing our best to figure out what needs to be done to keep that assistance. Many of our currently funded programs have actually requested to come and speak to council. We're meeting weekly to talk about that, to give council members an idea of how important this is. So the department really is concerned about that fund and the ability to spend in that way being eliminated. And I would love to have further conversations on how we can mitigate that. Some initial thoughts we have are to look to some of our philanthropists, to see if we can get donated funds or gift acceptances to cover that. Also, this is a conversation we'll have with the county as well to see how we can collaborate. But I really strongly believe that we should start talking about ensuring the city can continue to provide those services.
Can you share who has notified you? Because again, from my understanding, that hasn't been the situation. Like the council is not a barrier. So I'm trying to get a situation of if the county is not doing that in their contracts with pretty much similar vendors, or also at the state level, who is giving that advice? Is that the city attorneys?
Yes.
So it sounds like the city attorneys, which is why I actually brought forward the legislative directive around violence prevention procurement practices, because I don't know if our city attorneys are not just up to breath about best practices in this regards and how we can reconcile ways in which we're serving or administering programs in the best way possible to meet the need and not also putting additional barriers in place. And I get we've been sued, and I get the over caution right now, but I also don't want to make sure we're putting barriers in place and then also creating a situation where we're not providing safety for our residents. So if the city attorneys need to be in the room with our experts, I'm more than happy to orchestrate that. But it's very troubling that if there's other government agencies who also have legal counsel who are able to figure out how to make this possible, then we should be able to as well. Yeah. So more than happy to advance that and get that going.
Thank you.
Next, I did want to know, can you share which TA support with the RFP? I know you mentioned, I forget which slide, it referenced cure violence, but I did see there is currently a RFP right now for a TA support that's trained in cure violence, which that did actually make me concerned for a potential lawsuit because that is trademarked by cure violence. So I'm also confused as to why we didn't just extend a contract with cure violence.
Thank you so much, Vice Chair Wansley, for that question. So the department sought a sole source contract with Cure Violence because all of our information and our expertise tells us that they are the foremost expert. It is a former director of Cure Violence that created the concept of the violence interrupter model, and they hold the proprietary information. We have to seek approval from the Permanent Review Committee in order to release an RFP. We did not get approval from that committee, and when that happens, we're forced to enter into an RFP. It was quite difficult for our staff to draft that RFP, knowing that this is the model that we want to be certified in. So your questions have gotten right at the heart of one of the challenges we've experienced in NSD, but our hands become tied when we don't get the approvals that we need. Oh, God, I don't like that silence.
No,
I'm sorry.
This has been a confusing day. This is one where we need an RFP. Somehow we were able to circumvent a partnership with the NAACP for mediation services somehow, and it's just the sense is not sensing right now, and it's just not making sense. Not even the gift acceptance. So many questions right now, but there'll be some follow up on that. And that's all the questions that I did have. Thank you, Director Nelson Brown.
Thank you.
Thank you. I don't see any of my colleagues on queue, so now we can proceed with which I believe is the last department presentation.
Good afternoon, Chair Chavez and council members. I am Leticia Cardenas, Assistant Director of Minneapolis Emergency Communications Center. I am covering for Joni Hodney right now while she is out. As you can see, our org chart is up for you all on display. We have been working on staffing. I think I went too far. Okay. Okay. So currently we have interviews occurring for our training and quality assurance specialist, this position we are hoping to have filled by the end of the year. Applications were closed on it, and we have candidates hopefully being responded to by 12/6. We have 2 supervisor openings that we have ad that just closed, and we'll be having interviews in the first week of December. Dispatcher and call takers. We have a total of 9 call takers that are currently in backgrounds and in the psychological testing state of applicants. And we have 2 dispatchers that we have given, we're attempting to hire, one of which will start on 12/15 and the other one will begin as soon as they clear the backgrounds and psychological testing. Minneapolis 911 is allotted full-time employees of 85, and we currently have 74. With all that are currently in backgrounds and we are running ads for, we are hoping to be fully staffed by the end of the year. Knocking on wood on that because we don't like to say that too loud in case something does happen. Going back to those numbers again. Our highest numbers were back in 2021 for our staffing, and our lowest was, and that was a 79. Our lowest was 53 in November of 2022 and through January of 2023. As of current, again, we are at 74. That is currently 1 admin position, which is our TQA specialist, 2 supervisors, and 8 call takers or dispatchers positions. Again, those are all currently in the process of being filled. This is our call volume for the last 5 years. We are currently trending for the last 3 months in an increase in our call volume as compared to the last 5 years. We are not exactly sure why that's happening, but we've got more calls coming through than we normally did. Call abandon overview. It's important to remember, and we always like to advise everybody again, that if you call 911 accidentally, don't hang up. We will answer the call as quickly as possible, and it saves us all time if you let us know that you don't need emergency services prior to disconnecting from the call. For the public to know, our phones ring for a maximum of 2 minutes, and then it will disconnect the call. And what happens with every single one of those calls that gets disconnected, they go to our abandoned queue, and one of our call takers calls back to ensure that somebody did or did not need assistance. We launched on October 31st, automated abandoned callback, which is known as AAC. It's a system that now helps us to dial back these calls to not tie up our call takers on just doing callbacks when a call gets abandoned. We have not yet gotten enough data on that to report back to how that's impacting us, and we hope to do that in the first quarter of 2025. Training and Quality Assurance Department for quarter 3 and 4 during October, so far in November, we've already completed all of our staff training. We haven't had a chance to have a full staff training for years now, and we were able to complete an all-staff training that we called Back to the Basics. We reviewed what customer service looks like with our staff, how to search out the answers to their questions. BCR and HR were both willing to present to us, which added some extra information for all of our staff on how those 2 departments work. Director Hodney also gave positive reinforcement to staff for the value each person brings to MECC. And we also wanted to ensure that our staff knows some information about how to take care of their own health. In the future, quality assurance will be expanded. We have been currently only able to do medical call processing, call QAs because of our staffing. And so we primarily focused on that. We're returning to our QA program to include more police and mental health calls to ensure that first responders and 911 callers are getting the best possible service. Moving into 2025, we will also be including radio transmissions in our QAs. Looking at the first quarter of 2025, our most recent software upgrade and planned upgrade in the first quarter of 2025 is designed to make our system work efficiently and our stakeholders' needs and prepares us for new technology to come. It helps with our CAD system to get some things updated. Quality assurance will expand more in 2025, helping our staff to grow and develop their skills by providing the best possible service for the communities that we serve. That, again, will be beneficial to hiring that TQA position that we currently are trying to get a candidate for. 2025, we still have a great deal of training to do. A lot of our training is going to be continuing education and also new call taker and new dispatcher training. Early in 2025, we will also be engaging in a training for all staff to have a better understanding of mental health calls and what the best services are to provide to the caller when calling in about mental health calls. We were able to get changed in the union contract effective January 1st, 2025, that call takers and dispatchers are now going to be referred to as public safety telecommunicators level 2 and level 3. Why that's important is that helps us to be solidified as first responders. It's one of the first steps that Metro area is making to try and get us certified as first responders in the state of Minnesota. And that's the end. With that, I will return it to Commissioner Barnett.
Thank you. And we'll just open it quickly. Oh, actually, yeah, Commissioner Barnett, yeah, you're good. You can finish this off, and then we can leave any potential questions to both of you.
Thank you. If you have any questions, go ahead.
Looking at the queue, colleagues. No? All right. There are no questions. So just thank you all for being here today. We appreciate these quarterly reports because it helps us ask the many questions that many of our residents are asking. So thank you for the presentation. So seeing no further questions, I will direct the clerk to receive and file that report.
Thanks.
Our next discussion item is a passage of a resolution urging the administration to adopt and implement the Safe and Thriving Communities Report and Plan as a city's 10-year comprehensive plan for public safety beyond policing. I'll pass it on to Vice Chair Wansley, who is the author of this item.
Thank you, Chair Chavez. So just have a couple of remarks on this, as I've had several presentations on this item, or presentations leading up to this item. So I believe we're all aware since 2020, our residents have been very loud and clear that they have wanted to see the city create and enact a plan to transform our public safety system for the better. And such plans have come forward as it relates to MPD. Those plans have manifested as the MDHR settlement agreement, as well as the pending DOJ consent decree. As for our non-MPD safety services, that has looked like the Safe and Thriving Communities report and 10-year action plan, which basically gave the city a blueprint on how we could provide our residents with a variety of preventative, responsive, and restorative safety services. And it basically has been long overdue for the city to formally adopt a plan that will guide our broader safety efforts, which now include social workers, the BCR team, violence interrupters, civilian investigators, and many other critical safety personnel. That said, my office has spent the past year attempting to work with the Fry administration to formally adopt the Safe and Thriving Communities Report and 10-year action plan. And despite being announced by the city more than a year ago, there has not been a formal adoption of this plan to signal to council or the public that this administration is in fact using this as a step-by-step guide to advance us into a comprehensive model of public safety. And I believe the lack of clear understanding of whether or not if this plan is that leading blueprint continues to fuel problems within various departments and creates confusion amongst the public about whether or not we have a plan, and when in fact we do. So for several months, I've been in multiple conversations with the Office of Community Safety, as well as Commissioner Barnett, to discuss the formal adoption process. And during my last conversation, however, I learned from Commissioner Barnett that they would not be bringing the formal plan through the formal legislative process, which is why I decided to move forward with the resolution that is before you. And the goal of the resolution was to basically do a few things. It's to show the public that the council would love nothing more than to formally adopt the public safety plan that the mayor has already articulated support for. It will also act as a public record upon which our residents can hold us accountable to. Additionally, the resolution would solidify our commitment to fully fund and expand our non-armed safety programs and services. And lastly, this resolution would indicate to the public that despite whatever actions or inactions may happen under this administration, council would be utilizing the Safe and Thriving Communities Report and Plan as our guide to effectively fund and use our oversight authority and to increase public safety for our residents. And while I am still committed to providing that clarity to the public, I will name in the last few days new information provided by our city attorney's office about the future of our plans has really caused a moment to pause. And I have actually asked the city attorneys to be present to give more context about what I have learned. Historically, though, cities nationwide, including Minneapolis, have utilized action plans in order to improve enterprise-wide alignment around long-term goals and have helped the executive and legislative branches to prioritize, strategize, budget ties, and uphold transparency and accountability around pressing issues like public safety. And this was the case with, the recent adoptions of the Transportation Action Plan, the Racial Equity Transit Framework, the Climate Equity Plan. But more specifically, in the last 48 hours, my office learned from the city attorney's office that effectively we will not be able to adopt plans here at the city of Minneapolis. Action plans are a critical component of cohesion for our government. It is now a tool that we no longer can use, and that new information has significant impacts for our residents. And I want more time to process this information and to strategize with my colleagues on how to effectively move forward and on how best to respond to this information. And I cannot stress this enough. Removing action plans effectively ensures that there is no formal alignment between council and the administration on the most important issues of our city, regardless of who is in office. And this decision by the city attorney's office, it basically invites the conditions of chaos and essentially less accountability and less transparency to the public, and creates more conditions of challenging dynamics within departments whom we are relying on to help us with legislative actions and to help us with our oversight responsibilities. And I am, again, still committed to taking legislative actions that will support the implementation of this plan, specifically the Safe and Thriving Communities Plan. But I think it's important to have more time to be able to reflect and process this information about now council or the administration not being able to adopt action plans anymore. So I am going to be motioning to delay this resolution until our next PHS cycle in early January, to give myself more time, as well as to process with other council members around what our next steps can be in light of this news, and to really get clarity on actually what's going on with the status of action plans. So I did ask, once again, our city attorneys to give more context about action plans, because I know a number of, all of us have been around. We all took up the climate equity plan together in this very committee last term. We knew the work our residents poured into helping us pass that plan, and the fact that that is our plan and our North Star for driving our climate equity work for the next 10 years. We know the significance of our Transportation Action Plan and how that's guiding our work to make sure that we're becoming a transportation-friendly city. And the idea that those plans, when they're expiring in the next 10 years, that we cannot create another one, that's very alarming. So I just want to make sure everyone has the same information. So if the city attorney can come forward and give more context and more information so everyone can have the same information that I'm working with, please feel free to share.
Welcome up.
Thank you, Chair Chavez and Vice Chair Wansley. First, I wanted to say that, the legal opinion on the Safe and Thriving Communities Plan and the adoption piece is a legal opinion on the structure of the executive and legislative powers in the charter and ordinance, and it's, not a comment on the importance of the plan. So the city attorney's advice to both the council and the administration is that the city council does not have the authority to adopt action plans. And specifically focused on community safety, under the ordinances, the Office of Community Safety is responsible for strategic planning and direction for the city's comprehensive approach to community safety. Adopting the plan, therefore, is an administrative function reserved for the executive branch. And because the function's reserved for the executive branch, adopting the plan under the ordinances and the charter is not a role for the council. And, I appreciate that there may be times where the executive branch asks the legislative branch for approval of a plan. But in the city attorney's office's opinion, that doesn't alter the legal analysis of the government structure, and it's not something that's waivable. And one piece of clarification on plans, too. When I'm talking about planning here, I'm not talking about plans that fall under the Metropolitan Land Planning Act, so like the city's 2040 plan. That's a separate statutory structure, and then the process under that act is followed. So I'm happy to answer any questions or provide any further context.
Councilmember Rainville.
Chair, I don't know if this is the appropriate time or not, but I do have what I think is a legislative directive solution to this, so I'll take myself out of queue and let the other council members speak to the attorney, but I would like to offer that when appropriate. Thank you.
Thank you, Councilmember Rainville. I do have a few questions. Can the city attorney, Bert, can you let us know who in the city of Minneapolis government has authority to pass and develop ordinances? In the city council, the city of Minneapolis government?
Mr. Chair, members of the committee, I believe that's the city council and the mayor.
Okay, so the mayor can draft an ordinance and pass it?
Not without the city council, Mr. Chair.
Okay, and then who appropriates funding for and approves funding in the city enterprise?
Again, Mr. Chair, committee members, I believe that is the city council and the mayor working together on that.
Okay, so thank you for those questions. I think it's my point of, I'm not sure why we can't work on plans with the administration. I'm not sure if this is the mayor's administration unwilling to bring forward a plan to work with the council to get in alignment on a city vision, or if it's the city attorney's office having concerns with a plan for the city of Minneapolis that is developed by the mayor and the city council. I think when we're talking about a future of public safety in our city, it is important for Minneapolis residents to understand that the city council and the mayor are working towards a shared vision of implementing a safety plan, developing a safety plan, funding a safety plan. If there is no consensus and if there is no consideration for what residents in other parts of the city care and want to see, I don't see how we are going to work together on developing a public safety ecosystem that goes beyond just policing, that addresses community safety challenges, that addresses gun violence in our cities if there is no shared vision and shared plan where the city council passes ordinances and the mayor signs or vetoes or lets it go. Where the city council passes funding for programs and the mayor either signs it, vetoes it, or lets it go. But the city council funds these programs, the city council develops these ordinances, so I don't understand why we can't work together on a plan, because what's going to happen in this instance is then the mayor is going to keep on bringing things to the city council, and if there's no shared vision, how are we supposed to work together? So I think my concerns here is it that the mayor's administration is unwilling to bring forward a plan to work with the city council, or is it that the city attorney's office opinion is that the city council has no jurisdiction over developing a plan with the mayor's administration?
Thank you, Chair Chavez. And our opinion, I think, is more limited than that. It certainly does not say a shared vision can't be developed, that the city council and the administration can't work together. It's that under the government structure, the formal adoption of the plan is not a role of the city council because the adoption of a community safety plan is reserved for the executive branch. So for example, Council Member Wansley has the proposal for the resolution in support of the plan, and the city attorney's office has absolutely no objection to that, and that is, of course, a way that the council can show support. The council, of course, can also ask the administration to come in and present on plans, have discussions here as well. So it's in our view, more narrow, limited to the formal approval of these types of plans that are reserved to the administration by the city council.
I just also wanted to provide some clarity. So that what prompted this is I actually learned the administration wanted to bring this forward actually in 48 hours to bring this forward for formal adoption, and they were advised by the city attorney that they should not. And this is what prompted this.
Okay, thank you. That's helpful context for us to understand. I don't think I agree with that assessment because I think it's important that when plans are developed, that a city legislative body also greenlights it, because if we're talking about future investments, future development plans, it isn't just the mayor that works on this plan. It's actually the city council that helps fund the plan, helps implement the plan through policy making, not through administration. But that's also the concerns I have with, I guess, the advice that we're receiving. So there'll be definitely follow-ups from my office, and I'll reach out to you, Councilmember Vice Chair Wansley. Thank you for working on this. We'll pass it on to President Payne, and then I'll pass it back to Vice Chair Wansley.
Thank you, Mr. Chair. So I'm not an attorney. I am an engineer, though, and I've worked closely enough with attorneys to know that both of these disciplines rely heavily on logic. And it's seemingly incoherent to me that we have this type of opinion, especially in light of things like the 2040 plan, which is mandated by state statute. I'm having a hard time seeing, again, not on any topic of safety is like one of the most politically fraught conversations we will have in this institution. I'm not talking about the topic. I'm talking about just the logic of this. It doesn't make logical sense to me that the governing body can't adopt a plan. I'm grateful to Vice Chair Wansley for giving us some time to think this through, because I think there's a real risk of setting some precedents here. There's a lot unfigured out about this new government structure. I think that there were some forces in our city that were moving very quickly to establish this government structure. They were taking an opportune moment, given the crisis we were under in our city, to push this type of thing through without fully thinking through all of the considerations. I think this is a risk to establish a precedent that the city council can't plan, but it doesn't seem logically coherent to me. This is not a statement on your judgment at all. I'm just literally trying to think about this as an engineer and logic, just in the abstract sense, and I'm not seeing how the reasoning works in this instance, particularly when we absolutely have the authority to create ordinances, and a plan can just be broken down into its subsequent parts, and those subsequent parts could be passed as ordinance, and I don't think there would be any dispute about what our authority is when it comes to drafting an ordinance. I think that a mayor could veto any one of those subsequent parts, and that would absolutely be within their authority, but taking a set of rules and codifying them is like the most basic thing that we would do as a legislative body. Calling those rules and parameters a plan versus an ordinance doesn't seem to magically make these different logical structures to me. And so I'm concerned that we are quickly moving towards a place in our governing structure where we will just write more ordinances in response to these types of legal opinions. And I don't know that actually helps us get to better governance. Maybe it does. Maybe the whole intention here is to really strictly codify what our intentions are using ordinance and letting that be the methodology by which we transform our legislative intent into action. On the other end of the spectrum, it would be nice if we could just send an email to a colleague and get some responsiveness to that and have our intent be responded to in that way. Now, formally, no council member can direct staff in any way. That was true even under the previous government structure. We only have power as a body, not as individual members. But I just want us to think structurally through this and think about the precedents that this might set, because I think a rational response to this opinion is to just look at all of the elements within the Safe and Thriving Communities report and just flood the zone with hundreds of independent ordinances to accomplish the same thing as just adopting the plan. That just seems like that would be a very circular way of getting to the place that we want to get to. So that's something that I think we should be really thinking deeply about, and I'm glad that Vice Chair Wansley is giving us the time to do some of those thinking exercises and probably deep conversations.
Vice Chair Wansley.
Thank you, Chair Chavez. Actually, yeah, I just wanted to say thank you, President Payne, for raising that piece, and also my disagreement with the opinion from the city attorneys in terms of, and why as the city attorney to reevaluate the climate equity plan, which was written in consultation with the policy staff in the executive branch. There's literally policy parameters included and baked into the climate equity plan, so much so I know because I passed one of the policies, or this body passed one of the policies, which was PCAR in the carbon emission fees, which was baked into the the climate equity plan. So we know there's policy parameters that are included in these plans. And so we bring them forward as a body and we bring them through the amendments. And that is why we wanted to bring this process through this formal legislative process in pertaining to the Safe and Thriving Communities report and plan. So it's unfortunate that for some reason today, or again, this is, I don't know what's going on in the city attorney's office right now, but it does warrant lots of conversations in terms of, again, the way in which government structure is being interpreted and what that means for our legislative authority. And yes, I do appreciate taking some more time to wrestle with this so that we can figure out how best to support the implementation of this plan and demonstrate to our residents that we absolutely are taking this serious. So again, with that, if there is support to postpone, I believe, I don't think I need a second for that. Or do
I'll second it.
Thank you. To January 8th, 2025.
So there's a motion to postpone those items to January 8th, 2025, which is the next Public Health and Safety Committee. All those in favor, say aye.
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 Can I jump in one last
Council
moment?
President Payne.
Yeah, sorry. I just wanted to say one other very rational response to this opinion. Not only would be writing ordinances, but it would also be to properly staff the legislative branch to be able to have the staff capacity to do the deep kind of planning that would translate into ordinance language. And the rational response to this, if this would be the opinion that stands, would be, let's look at all the hundreds of professional staff in the administration that helps build these plans, the policy staff that helps build these plans. Let's rewrite the budget, which is solely our authority to do. Move all of those staff over to the legislative side, have them, instead of do planning documents, have them create legal documents around ordinances, and then adopt them as ordinances. So I just want to make sure that we fully understand the consequence of this type of legal opinion. More ordinances and more moving of resources from the executive branch to the legislative branch to accommodate the capacity necessary to deliver on those ordinances, of which the administration is required to then enact as enforcement of law rather than operational implementation of plans.
Councilmember Rainville.
So I did submit an amendment, a friendly amendment to the Wansley motion, if we want to consider that. And I did vet that with the attorney's office. I feel it does achieve the same results that Councilmember Wansley wants to achieve. At this time, would you entertain that amendment, Chair Chavez?
Thank you, Councilmember Rainville. So I think in this instance, given the conversation we're having on this, I would recommend that we move forward with a delay of the January 8th Public Health and Safety Committee meeting. I think that the draft legislative directive in front of us, we should have more conversations, in my opinion, about the implications about delaying it and then figuring out what we can bring forward in that same meeting. So I would recommend that we simply delay the item and then bring this forward at that same meeting as well.
So delay both the amendment and then also the legislative directive?
Correct. With the resolution, yeah. Are you okay with that?
Well, I can count the votes, so I'm going to say yes.
Okay, cool. Yeah, I think we all need to have more conversations about all this, and I think we're all trying to head the same route, but I think it's smart for us to just figure this out in January. Okay, so with that, we'll be moving forward with the delay. We're also considering this in the January 8th committee meeting of PHS. All those in favor, say aye.
Aye.
Those opposed, say nay. Cool, thank you. All right, so now we are moving forward to the next item, which is the Safe and Thriving Community Action Plan update. Sorry, there's a lot today. Welcome up, Director Amanda Harrington.
Good afternoon again, Chair Chavez, council members.
Thank you.
In August, Councilmember Wansley brought forward a legislative directive requesting a detailed update about aspects of the Safe and Thriving Communities report implementation. The first request was specifically related to the launch list and the progress of those activities. What you can see on the screen is that 20% of the activities on the launch list are complete and 73% are in planning or in progress. The report that was written by Dr. Oftilly and his group at Harvard includes a lot of very detailed recommendations, and my team has been working on the best way to implement those suggestions. We have not just been working on the launch list, but that is the scope of my update during this presentation currently. I will note as we go through the launch list activities, you will sometimes notice highlighted text. Those are areas of difference between the suggestion in the Safe and Thriving Communities report and how we are choosing to implement the Safe and Thriving Communities report. The first action area of the launch list includes establishing an executive leadership team and community advisory board. I'm going to go through the 3 activities under that. The first is to establish an executive leadership team composed of city executives. One of the goals we have already accomplished is this area. I've previously spoken to this body about the steering committee that works with the design and implementation team, and I have noted the members of that committee. That is what you're seeing on this slide. Another activity in this area is to establish a community advisory board. I've previously mentioned my plans for a community advisory group were in progress. I will note that I hadn't previously shared the details of that plan, and so I have updated them to the LIMS file so that members of this council or committee can see those recommendations as well as community members. I just want to note that if the city wants different results, we have to try different tactics. I hear that consistently in what people talk about with policing as well as our expanded response options. I think this pertains to the community advisory group who works on this community safety work as well. Appointments by elected officials is typically the way that we handle appointed boards and commissions, but my proposal offers a different path in that the group would be a work group where applications were reviewed by and member recommendations were made by community members. My proposal is currently on hold because I understand that council members plan to put forward more of a traditional appointed boards and commissions project, and having 2 very similar groups would be confusing and not in the best interest of this work. But I do hope that my suggestions for a path forward are considered in the future. The third activity in this first section is creating a law and policy agenda. We're still in the planning stages for the law and policy agenda. We have had an initial meeting with the Intergovernmental Relations Department of the city and plan to continue working on this with Office of Community Safety and Office of Public Service Leadership. The second area of the launch list is to develop a multi-year implementation and financial plan. The first task within that is to determine the degree of adoption and pace of implementation. You'll notice that my suggestion is that the implementation plan focuses on the next 3 years. The Safe and Thriving Communities report in its entirety may take up to 10 years, and it is very detailed. So for us to detail exactly when we will have all of the tasks done for the next 10 years is unreasonable. We have to maintain some element of flexibility in this work to respond to the needs of our community, as well as financial and other factors that we can't possibly foresee right now. So we have worked out the activities that we can complete in the next 3 years. Those are posted online, and each year we will consider funding and staffing to tweak the implementation plan and make sure that we're continually looking forward. The next activity is to identify and the report said allocate sources of federal, state, local, and philanthropic funding. My suggestion again is that we identify the sources, which is a great starting point given where we are in the process, but allocating those sources over activities that are 5, 6, 7 years in the future doesn't quite make sense. We can't allocate all the funding at one time for things that we can't possibly foresee in this exact moment. The last task in this area is to commit a set number of development goals and completed pilots within the first year. I have been giving regular updates to this body about the pilots that we've been working on. There are some pilots that are obviously planned and a few that we think will come to fruition in 2025 early on, including the embedded social worker in 911 and the safety ambassador pilots. That doesn't mean that those are the only pilots that we're working on. I've previously mentioned a pilot to expand traffic response, and we've also talked about the juvenile deflection pilot that we will continue to work on. As you know, performance management and innovation does help us with pilots, and they can only handle so many pilots at a time, and we've determined that around 3 or 4 is the right number for us to work on each year. Related to the development goals, we were waiting for the policing project to finish their analysis and their recommendations to come forward. Now that we have that analysis, we will be able to determine how many of those development goals we'll be able to do in the next 12 months. The third area of the launch list includes designing a governance and operations plan. And the first activity is really to build a plan for cross-agency and cross-sector collaboration so that we can sustain progress on implementation of this community safety ecosystem. In talking with Dr. Oftley about this suggestion, the matrix aspect of the recommendation was really less important than having a plan. This one is interesting because we are doing the planning and we are doing the work at the same time. So I'm not just starting with planning for collaboration, but you've heard me talk about collaboration that is already happening with Metro Transit, with Parks and Recreation, with the county. But to get this full comprehensive plan will take a little bit more time, which is why you see a further out deadline. The next task is developing a law and policy framework. There's already work being done in this area with the Information Governance Council, and what I understood from my initial meetings about that is we should have some information by the end of this year, but this will likely be an iterative process that we have to continue going back to, and that's true for a number of the activities in the Safe and Thriving Communities report. We may have something that is done, but that doesn't mean that's the only time that we have to look at that activity. Some of them are ongoing and some of them will have to be reviewed regularly. The next activity is anticipate and plan for cross-initiative work. And this is really talking about the work between the Safe and Thriving Communities report and the settlement agreement or the consent decree. As you know, we do not have a consent decree currently. We do have a settlement agreement. I have been part of a number of those discussions, and planning has been ongoing that really incorporates both bodies of work into facilities. You've seen that with the South Minneapolis Community Safety Center. I'm also at the table for discussions of additional facilities related to recommendations that have come up in the settlement agreement. I'm also involved in discussions around behavioral crisis response and the city enterprise data collection and collaboration. The fourth area of the launch list is to initiate policy and practice committees and work groups. This is something that we started early on, but I will note that one of the recommendations was to establish clear executive sponsors for each section of the Safe and Thriving Communities Plan. My vision for this work is really collaborative and breaking down silos. So the recommendation of having a specific sponsor for each section feels contrary to this collaborative system that I'm trying to create. Instead, we are going to further culture change in this city by having enterprise-wide collaboration. That's why you see that this particular activity has been excluded. Implementing committees focused on the core areas has already been completed. This was done after I began working with the city. I mentioned at an earlier presentation that the committees that we initially established did not match the recommendations from the Safe and Thriving Communities report, given where we were in doing this work at the time. At that time, we had conceptual services and resources, community relationships and engagement, infrastructure and design, and finance. Some of those committees will continue. Some of those committees will be revamped as we move into the next phase. We've said all along that these committees will change as the work changes, and so that is happening in this next year. You will see committees more aligned with the recommendation. We'll have committees focused on prevention, response, and restoration, and we'll be addressing governance, management, and accountability in the steering committee. There was also a suggestion to implement cross-functional teams. Well, the cross-functional teams are the committees that we've been working on. They are made up of individuals from across city departments. So we already have that done. The fifth area is to implement a community communications plan and progress dashboard. And part of that plan would be to have a multi-year community engagement and I would say communications plan. We've been working with communications and with the neighborhood community relations to work on these plans. We have high-level plans, and now we're going to meet to work on the specific implementation, really digging into the weeds about month by month, how are we going to push this forward. But the visions that we've agreed on are we need to help explain to city staff and to our community members what is this ecosystem that we're trying to build, what is our vision, what makes up the ecosystem, so what are the services that we already have and the services that we need to create, how their voices can be heard throughout this work, and what their role is in the ecosystem. I've said this before, but the ecosystem is not just made up of governmental bodies, it's also businesses, it's community groups, and it's individual community members. And sometimes it's challenging for individuals to know what their role is in helping keep their community safe. So we will be working on communicating that. It also talked about hiring community ambassadors. My suggestion in this area is rather than jumping straight to hiring additional staff, which is a cost burden, that we currently look at the staff that already exists in the city and see if we can identify any of them that can do this work. I believe we have a number of community-facing positions already that interact with safety, and it may be better for us to make sure that we're aligned with those positions. And then also producing a dashboard to track progress. That has been done. I've been providing updates to this body as we've had multiple iterations of that dashboard. It is currently online for anybody to see, and it's automatically updated weekly on Fridays. Another aspect of the legislative directive was a detailed overview of departments connected to tasks. That would take a very long time for me to read, and so instead I did upload a document into LIMS that talks about the tasks in the tasks and which departments we think are connected with them. Again, that's been really fleshed out for the next 3 years. Once you get beyond 3 years, there are some gaps, but we will fill those in as needed. And the departments may change as we go deeper into the work. We may find out that we missed somebody, or that somebody that we thought had a hand in a task maybe is not needed. So we do need to maintain flexibility. And I will note again that the online dashboard that's up has this information available to it. So you can see on the screen the circles. Those show you how many activities are related to different departments, and if you were to click on one of those circles, it would narrow down and show you the specific activities that are aligned with each department. The last part of the legislative directives was for additional recommendations about action steps or other feedback for this body and for the entire City Council to consider. I've noted already that there were some wording changes that we included. What I want to start off with is tasks that were already completed or were obsolete already when I came into working on this work. So one of the recommendations, and these are just examples, was to implement recruitment and hiring plan for 911. By the time I had started with the city, a hiring and recruitment plan was already done and in existence and had been utilized. We hired quite a few 911 workers, and you heard the update from Leticia earlier today about how they continue to work to maintain their staffing levels. There was a recommendation to check the box for criminal history. That's already illegal in Minnesota, so there's no reason to include that in one of the activities that we would work on. Implementing project management software. The city already has project management software through Smartsheets. That's why they bought the software, was so that we could utilize that. It's meant for project management. And ensuring 911 has an equal voice in matters related to public safety. I've discussed this with Director Hodney multiple times, and she's noted since Commissioner Barnett started with the city and they've been at the table for the regular meetings with other Office of Community Safety departments that she feels that they do have an equal voice, and that's substantially been addressed. It also talked about institutionalizing pilots. And those pilots at the time of the Safe and Thriving Communities report were really the overnight traffic pilot and BCR. Those have both been institutionalized. They are no longer pilots. They are just things that we do here in the city. Some of the other activities where there's some wording changes or I think we need some flexibility include recommendations for online feedback. Online feedback is one important way for us to get feedback from the community, but as all of you know, it's not the best way for all of the cultures, the diverse individuals that we serve in our community. And so sometimes we've taken that out of recommendations. That doesn't mean we're not going to get feedback, but we're not going to lean into only online feedback. Similarly, the Executive IT and Data Steering Committee recommendation is really related to 911, but that work impacts more than 911. And so there are some times when activities need to be more expansive than the recommendations. A similar one was a recommendation for a directory that included prevention services. Prevention services aren't the only safety services that we provide in the city. It doesn't make sense to limit ourselves, and so as we're creating a directory of safety services, we're looking at prevention, response, and restoration. So there are some times when you see me taking away words, and there are some times when you see a goal that's much more expansive than the recommendation in the report. The last piece about what does City Council need to know, I think it's really that our work does not align with city budgetary timelines. It doesn't, and that's not the way the city works in general. It's not the way the city has worked, but it is what it is. We have the NYU policing projects recommendations coming out today. I will work on them. I will work on the Safe and Thriving Communities report, and it doesn't always align with our timelines, and so we have to have flexibility. That means it may mean having pots of money set aside so that we can utilize them. It may mean working and leveraging resources with our partners like the county or the state. It may mean applying for more grants, and it may mean tapping into our philanthropic partners. And so all of those are on the table as I'm doing this work with the Safe and Thriving Communities report. Just because there isn't a budget line item that comes from the administration, or maybe it doesn't come through the amendment process, doesn't mean that we won't get the work done. We'll just be creative in how we get the resources to do it. That concludes my presentation. I stand available for questions.
Thank you, Director Harrington. I'll first pass it to President Payne, and then we'll see who else gets on cue.
Thank you, Chair Chavez, and I'm in a second time for Councilmember Rainville. First things, I don't know if this was on LIMS, the presentation, so if maybe I wasn't in the right spot. I don't know if you could work with the clerks to get that up there. But my question was around information governance. I'm working with the city clerk around a broader policy management framework for like beyond just safety policy, but the entire enterprise is got a challenge with having updated policies in every department. And I'm just curious, I can't remember on which slide it was that you spoke to it, but it sounded like there was like a formal internal work group or committee that had an information governance focus. Just wanted to make sure that the city clerk was plugged into that body of work so that the things that I'm thinking about from my perspective is also like, these shouldn't be silos. All of this work should all happen in an integrated way. And I think that's one of the things we've actually witnessed a lot in the safety arena is that a lot of the challenges we're facing are because of how siloed information is, how siloed policies are, how siloed even almost similar to your point about some of this work doesn't exist within the city budgetary process. That budgetary process forces a set of siloing as well, not just time constraints, but functional constraints. And I think from an information governance perspective, we need to break those silos down. And I'm working with the clerk to make sure that we have the right resources to do that, but I want to make sure that we also have the right workflow to do that as well, especially in light of conversations around the role of city council and planning.
Chair Chavez, Councilmember Payne, first, I apologize for the presentation. I did send that to the clerk's office over the weekend, so I'm sure we will clear that up and get that uploaded as soon as possible. Secondly, I think what you're referring to is when I refer to the Information Governance Council.
Yes.
And that's something that I learned about from our IT department, so I can't speak to exactly who's on it, but I know it exists.
Just make sure you are working at least with me on that so that we can have that cross-enterprise perspective on how this body of work plugs into that body of work. Thank you.
You're welcome.
Thank you. Next up, we have Vice Chair Wansley. Councilmember Rainville. I saw your name twice here.
Thank you. My workstation isn't where I can't log in. Thank you, Director Harrington. Very thorough, very great information. How has your response been from the county, Metro Transit, the park system about this cross jurisdiction, getting them to be part of this safety plan? Have they been open to that? Are they responding?
Chair Chavez, Councilmember Rainville, I have not met with them specifically about the overarching activity or the specific activities in here, but they've come to the table when I've asked for collaboration. So they are currently meeting with us regularly related to violence interrupters and other street outreach. I have met with a lot of individuals about how we're collaborating around the safety, community safety centers and other sharing of resources and ideas. They have all been very open to that collaboration. And so I think once we identify specific activities in here that really need outside partners to come in, I would expect the same level of ongoing collaboration.
That's wonderful to hear. Needless to say, the county has a very large budget, and they actually have a violence prevention department. So if we could be partners in their success and their kindness, that would be great. And Metro Transit as well. There's I met last week with some officers and the director, executive director, and the head of their operations, and it's just very frustrating. I can't reach them. I wish you the best of luck. I hope you can reach them. Thank you.
Thank you. Next up, we have Vice Chair Wansley.
Thank you, Chair Chavez. Just want to say, Director Harrington, thank you for this presentation and demonstrating that there is a commitment among the administration towards full implementation of majority of that launch list and much of what has been included in the Safe and Thriving Communities report. I did want to at least share in terms of the flexibility piece and why there is the hesitance amongst council to see that inclusion of budgetary commitments. I know this body gets nervous, for instance, around BCR and the institutionalization and knowing that it almost was eliminated just last summer because we didn't have a commitment. We assumed it was just going to be there and it was fine. And then we learned it was not fine in the midnight hour and had to rush through a last minute amendment to save it. And I don't think no one wants to see any programs, knowing that majority of our safety services minus MPD is contract based. We don't want to see that happen. And I think we often take for granted that those things are just running. So I think often, like, whatever we can do to partner to say, like, how do we revisit either the financial, and I know that's part of the Safe and Thriving Communities report of, like, how are we thinking about the longevity of these programs, especially those that are mostly contract based. I know BCR, when they came and presented before us, they asked for what does it look like to extend a master contract or a 10-year contract? How are we looking at that for our violence interrupters? And I know there's, so lots of concerns around bringing those in-house. I know we tried that with violence interrupters when we first rolled that program out in 2020, and people was like, we don't trust the city. They were throwing food and snack, like when they were in the yellow shirts, they were not for it. So we had to transition to an external entity because we don't have that credibility in the community. But with that said, how do we start to guarantee more financial security for our contractors while also navigating what came up earlier around all of these barriers that's being put in place by some of the advice that's coming out of our city attorney's office that might be complicating our ability to get services out on the streets. So I think there's going to be a whole host of conversations that we're going to have around, like, just the, again, financial security of these programs and the longevity of them based off of how we are funding them. But I think that is a goal that is shared amongst this body. We want to see them fully funded. We want to see these pilots be able to be fully absorbed. We don't want to see them basically living paycheck to paycheck, which most of them are essentially right now. So anyway, we can continue to be part of that conversation. And I don't know if that is addressed in the NYU report. And I will name, the report isn't on limbs. I know the presentation is. So it would be good if that will be part of an ongoing analysis, because I think that's going to be imperative if we're going to be successful in this work too.
And I don't think we have anybody else on queue. So thank you, Director Harrington, for that update. We have 2 more presentations, and you may still be up here. So the next, seeing no further questions, I will direct the clerk to receive and file that report. Our next discussion item is item number 16. It's receiving, filing, and presentation regarding the policing project community safety ecosystem asset and gaps analysis. Thank you.
Stand or sitting?
That's up to you. Chair Chavez, you were correct. I am staying up here for this, but I'm joined by a guest, so I'm going to do just a brief introduction and then turn it over to the expert. One of the recommendations from the Safe and Thriving Communities report was to conduct a government capacity and services gap analysis. That started around the same time that I started with the city. The city contracted with NYU's policing projects starting in December 2023. Their team is made up of experts, but they also contracted with experts, including Dr. Oftali, the author of the Safe and Thriving Communities report. The outcomes of the initial work with the city and NYU was for an asset and gaps analysis, which includes an analysis of calls for service, as well as expanded response dashboards. I will note that this is a 2-year contract, and so the first year has really been focused on analysis, and the second year will shift into support of implementation of recommendations. We do not have the full glossy report, as one of the council members noted. That is forthcoming in a couple of weeks, but the report is done, the data is available, and I will turn it over to Alex Heaton from NYU to share that information.
Thank you very much.
Welcome.
Good afternoon, everybody. Thanks a lot for having me. My name is Alex Heaton. I'm the Director of Reimagining Public Safety at the Policing Project of the NYU School of Law. I'm excited to talk to everybody today. Okay, so today we're going to be speaking about the asset and gaps analysis that we've been conducting over the past year. I'm going to go through a little bit of the background of how we got here, talk through the methodology that we used to conduct the analysis, and then I'm going to dig right into our findings and recommendations to address those gaps. Good. So this builds off of Dr. Oftali's report. The city's already agreed on what their vision and framework is for how they're going to reimagine safety here in the city. And our job is really to help make that vision a reality. So what we've done is we have been working, speaking with folks across the city. The city's already built a solid foundation of community safety, and we have just really we've really begun the process of implementing that, and like I said, making it a reality. So what we did was we did an assessment of the existing assets, the existing programs that the community already has, and then basically saw what was not there, what did we think could be expanded into that space, and what maybe needed new programming to fill some of those gaps that we found. We looked at what the demand for services was, which we proxied through looking at calls for service to 911, calls to 311, and use of your online reporting system. And then we also looked at how these programs are being measured for their effectiveness, how the results are being communicated out, and then we looked across there and really put together a menu of suggestions for how some of those gaps could be filled. So how we collect this information was the first thing. We worked with the city to distribute a questionnaire. The questionnaire asked a lot about the kind of how these organizations fit into the community safety ecosystem, what they did, how many staff they had, what they thought the barriers were in the community to furthering safety, what they thought the barriers were within the city process, and what they would do if they had more funding, or what they would change if, for kind of their reach goal. We conducted follow-up interviews with a number of these folks who responded to the questionnaire, as well as folks that were referred to us by the city. We complemented that with a data review. And so the data review was, we looked at, again, these 911 calls for service. We looked at some of the incidents that were reported in the city's Cognos system. And then we compared that with also with the 311 reporting as well that we had access to. We took a lot of these calls for service and we compared it with what other municipalities were doing across the country, so we could see if there were places that had already addressed some of these concerns with a non-police response that the city could possibly replicate here. And again, we spoke to folks who responded to the questionnaire. We spoke to folks who responded to our attempts at outreach. We referred to the Office of Community Safety to help if we weren't hearing back from people, but there are limits on the amount of folks that we spoke to. We didn't speak to everybody. We didn't speak to all the community-funded organizations that were maybe funded by the county or by the state. So there are limits to the folks that we spoke to. Okay, let's jump into to some of our findings, and then we'll get into some of the gap action recommendations that we have for those gaps. As I said, the city does have a strong foundation of programs that they're already implementing. A lot of our work is really to focus on how to get more out of these programs that already exist, whether that be through expanding the programs, expanding the types of calls they respond to, or in some case reducing the responses. And the goal of this is to make sure that they are getting the correct response to resolve the person's concern, centering the concern above all else here. The city already has a alternate response ecosystem that is already doing great work. We've spoken a lot today already about BCR. We also have the traffic control unit, which is doing really exciting things. We have animal care and control, and which we were particularly excited about was the 311 and online responses. The city's already shifted these calls out of the 911 queue to allow folks to either to fill reports from the comfort of their own home and not necessarily have to have an armed response come to do that. These are a big deal. They're excited too. These are a really big deal. We work with cities across the country, and cities are just starting to put together their own ecosystem, and so we were thrilled to be able to come to Minneapolis where this work has already been started and start so much further down the line. So again, last year, BCR responded to 67% of their eligible calls that are assigned. This is huge. This means that the 911 call center is able to identify these calls that should be sent out to BCR, and BCR is able to respond and resolve these in a manner that the community is really happy with. This means that we know there's more opportunities for expansion. We know that they're able to do the work, and I'll get into it in a little bit about this, but we know that the primary barrier here was logistics. It was a lack of access to vehicles. It wasn't a case where these folks were going out to respond to the calls, and for whatever reason, they weren't able to do so. So this was really promising. I've already spoken about the 311 online responses. Again, really exciting that we've been able to identify calls and say maybe these would be best suited to somebody else, especially where the primary need from the individual calling is for a report. And the traffic control agents, again, the expansion of the traffic control program is really exciting. We don't need officers responding to parking calls. And I think this is something that in our recommendations you'll see we recommend expanding this, we recommend expanding the types of calls that these folks are responsible for, and I think this is a really exciting platform that we can build on. But really, what I want to say here is that there is a network of providers that are working in this space that are super excited about the work that they're doing, and this will make it that much easier to kind of expand the footprint of this alternate response ecosystem. So I want to talk a little bit about governance first. Governance is the thing that came up over and over and over again in these conversations. So the city really has to be able to manage these programs, to define what programs fit inside this kind of ecosystem of community safety. We need to be able to have concrete processes that dictate when and how they're used. We need to be able to make sure that these entities are being held accountable for implementing their programs and their policies, and also that they're sharing data in a manner that we can share out with the community, so the community can say, this is what's happening near my house when I have these concerns. So the governance action items are, again, it's going to be defining the community safety ecosystem. We're going to be supporting our community safety providers with the things that they need to be most effective. We want to make sure that we are reaching into the intended population that these programs are meant to serve. Once we have a program that exists, we're going to make sure that it's being utilized as much as possible. We're going to measure what they're doing and measure the impact so that we can prove to the community that this is a validated program for creating safety. And finally, we're going to have a mechanism to hold organizations and agencies accountable for making sure this happens. And I'm going to get into this a bit further now. So the first one is defining the community safety ecosystem. So we need to know which programs contribute to community safety. And what does that mean? So that means, like, we know, when we talk about the directory, we know exactly what we're talking about. We know all of the programs that fit into here, and within each program, we know how they do that. So does this program have a theory of change? So when this program does this action, it creates this outcome, and this outcome fits into our larger picture of community safety. And every single program should be able to say what that is, so that we can say, okay, this is definitely a program that is creating safety in our communities. If we don't know that what programs are part of community safety, we don't know how they create safety, we don't know if our system's working, we don't know if this ecosystem is contributing to the larger goals. We also need to clarify the relationship between departments. This is something that also came up a lot. Departments need to be able to count on each other, to be informed of what each other's doing, and be held accountable to a clear chain of command. We need an organizational chart across the city that shows who is responsible for what. This includes who's responsible for innovating, who's responsible for implementing, and who's responsible for just keeping the lights on, keeping these operations moving forward. And I think that's essential. Within that, we need naming conventions that make sense so that everybody understands what's going on. And then finally, complementary services. We spoke a lot today about silos. We want to make sure that work isn't being done in a silo. We want to make sure that there aren't missed opportunities for collaboration. And we want to make sure that we can ask who else is working in this space and who else is funding the work. So when we conducted this gap analysis, it was based on city-funded entities. We knew immediately there's entities that are funded by the county, that are funded by the state, that are maybe funded by private entities. We need to be able to map everything out so we know, hey, maybe this part of the city has nothing, and that's where we go in and fill that gap with effective programming. Supporting community safety providers. This came up a lot. Once we have this kind of defined organizational chart and we know what everybody's doing, we need a central grants and contract management system so that we know who's funding what, we know when the contracts expire, we know what the contracts include, and who's managing each contract. We need to reduce the likelihood of multiple agencies working on the same thing, again, or that assuming somebody else is working on it. We need monthly convenings so that everybody who's working in the space knows each other and knows what they're doing. And kudos to the city, this has already started happening. We went to one of these just this morning. We need to know who's there. We need to identify opportunities to work together, and they need to be able to have this opportunity to uplift challenges to the city so that the city can address some of these barriers and make these programs more effective. We need to be able to share data with the community. This came up a lot. The community providers are not aware of what the safety trends are. A lot of this is being passed via word of mouth, or they're waiting for press conferences or other things to get an idea of what's happening. There needs to be a cadence for regular data sharing, and there needs to be a way for community providers to request additional data if it's going to help them be more effective. This might include information like when and where overdoses are happening, when and where incidences of violence are happening, robbery, burglaries, and then these providers, these agencies, they can adjust their programming so they can be more effective again, and this can reduce the burden on the 911 system so that law enforcement can focus on the investigation and deterrence of violent crime. And finally, stability via long-term funding. This was something that came up. Using short funding solutions, and you end up with gaps in funding, and the worst possible thing that can happen here, outside the obvious, that these violence prevention organizations aren't working in the community, is that these folks are leaving the industry. Hey, I can get a better job doing something else where I'm not going to have these gaps in payment. And so this kind of professionalizes the industry a bit and keeps that institutional knowledge in-house, which is essential. Reaching the intended population is key. So the first thing the city has to do with any of these programs is get an idea of who is eligible for the programming. It's hard to design the right program and make a plan unless you know exactly who you're serving. If there are 10 treatment slots that are really effective for opioids, but you have 1,000 people with substance use disorder, the program could be as effective as you like, but you're not reaching the entire population. So you have to be able to look and see what the universe of people is that needs help. Similarly, the program has to be able to reach intended populations. If your program only operates in English, you're only going to reach the English-speaking population. This is something that came up a lot. And we know that there's a number of languages spoken at home in Minneapolis, and we need to make sure that programming is incentivized to make sure their staff can reach those populations. Also, maximizing utilization. I want to build on the opioid example here for a little bit. Let's say now we've adjusted the size of our opioid treatment program to 1,000 people. It doesn't mean anything if we're not getting 1,000 butts into those seats to get the treatment. The city needs a clear criteria for when people are going to be referred into these treatment services and should be collecting data for when they're referred and when they're not, so the policy can be adjusted to make sure that we're getting as many people in treatment as possible. And again, it's reducing the likelihood of them having a contact with the criminal justice system. And then again, we spoke about collecting data and sharing data in a manner that's transparent so everybody can see that these programs are being effectively utilized. Now, once we know who the program is for and we're getting people in the door, we need to focus on goal setting and monitoring. We need to know if these programs are working. This is something where we need to have a regular cadence of goal setting with all of these programs to see, hey, are we reaching the number of people? Do we need to increase the size of the program, the size of the people that the program can serve? And how do we know if it's working? We need to have information shared back with the city. It needs to be standardized. We spoke with a lot of organizations that have their own data collection methods, and maybe they're calling the same variables different things. It's not lending itself to the city knowing how these programs are being used, and it's not lending itself in the future to a program being evaluated. and that's the next part of this, is the independent evaluation. There are so many innovative and super exciting programs in the city of Minneapolis that aren't being evaluated, and it's an opportunity for the city to acknowledge that what it's doing is working and to really influence the discussion on a national scale about what can be done to make the community safer. All of this work should be getting evaluated by an independent external evaluator. And accountability mechanisms. With an effective monitoring and evaluation program in place, these results need to be fed back into the agencies and contractors and hold them accountable for making sure that once we've identified these challenges and these barriers, that they're addressing them so that they can improve their ability of their programming to create safety. This needs to happen at a regular cadence so that the challenges remain manageable. Sort of similar to what we're doing today, but at a much smaller and more regular clip so that these don't become larger problems in the future. And again, making sure that once we've done this, these data are being made available to the public via the dashboards, via regular updates, so folks know these concerns are being addressed that may have been raised. Next again. All right, now I'm going to get into some more of the actual programming itself. But I just want one more thing on the governance. This should happen either before or alongside any of this. It's so important to make sure the structure is in place before the program itself becomes expanded or added to. So next we're going to talk about our violence prevention and intervention section. This is really, we spoke to violence interruption organizations. We heard from some of the GVI organizations and spoke to some of the organizations that conduct ambassador or ambassador adjacent work. We're going to go right into the action items for these, but feel free to obviously ask questions when we're all done on this, and I'm happy to expand. The first thing is our shooting notifications. So one thing that was really common across the board was that there is a kind of a relationship-based notification system for if there has been a traumatic incident, if there's an incident that may rise to the level of shooting. And this is kind of happening through text messages, through phone calls. There's not a formal notification system happening. And this is something that would greatly reduce the time from a shooting occurring to some of these organizations being activated to go and do what they do in the community and reduce the likelihood of retaliatory violence. This needs to happen with the folks who are on the street, the folks who are in the hospital, the folks who are in the schools. There needs to be a way to notify everybody quickly so that they can get to work right away. On the back end, there needs to be a regular meeting cadence for when there are shootings so that we can go through and make sure everybody did what they're supposed to do in these shooting reviews. So did this get activated? Did they bring up, like, we need these resources? Were the resources provided? How can we make sure that this doesn't happen again in the future if it took too long or the resources didn't show up? And these sort of reviews are key to make sure that we're being as effective as possible at stopping this sort of retaliatory violence. The second thing in there is the wraparound services. We're going to get into this in a little bit later, but employment and housing came up over and over again, and making sure that we're not providing employment trainings or housing meetings, but we're providing jobs and we're providing housing. This is something that would greatly reduce the likelihood of victimization and would kind of reinvest this into the community and reduce the likelihood of individuals participating in violent activities in the future. We spoke about this in the governance section, but this is very, very, very important, is making sure that these organizations are providing data analysis in a manner that enhances their performance. A lot of organizations were kind of providing bits and pieces every now and then, or not at all in some cases, and this is something where we need to standardize the data across the board that's being shared, and share it through to the city in a manner that lends itself to analysis and adjustment if it's not as effective as it could be. The last one of these is the last action item, is addressing the geographic and temporal coverage gaps. We saw quite a few when we mapped it out, and we'll go more into detail on that in the report. but we need to make sure that these organizations are working at the times when we experience the most violence, and on the days that we experience the most violence, and in the neighborhoods that we're experiencing the most violence in. And what we saw was that not all of them not all of these seem to be based on that specifically, but maybe were based on these patterns that existed 3 or 4 years ago. Okay, so next is our community capacity building programs. These are preventive programs where we build the capacity of the community to either heal from trauma or reduce the likelihood of a traumatic event happening in the future. And this really looked at targeted employment and targeted housing for folks, especially victims, and finally building community connections between one another, which would reduce the likelihood of community violence. So this is probably one of the biggest action items across the whole list is transport. What came up over and over again was that the location where we needed to take people may be significantly far away from where we picked them up, and folks weren't comfortable or couldn't afford to take public transport. And as a result, they had to wait until a days later in order to be connected with services. We know that if there's a warm handoff that happens, the likelihood that somebody takes on services skyrockets. And this is an opportunity for the city to address that with a city transport solution. This is also an opportunity for a type of employment for our reentry population. But this is something that would really help kind of interrupt some of these cycles of crisis and violence and came up in almost every single conversation. Also, we need a dedicated platform for requests of city services. So what we heard from a lot of the ambassadors, from a lot of the folks that we spoke to who were going out to the encampments or looking at vacant buildings was that when they hear from people, it's a phone call, it's an email, it's a text message. And so those go into an Excel spreadsheet back at the office. And then the city's not really able to document that. What we need is a ticket-based system so that all of these are being tracked. And the reason why these should all be tracked is because the city is doing this work, and the city should be able to celebrate the work it's doing. Say, last year we responded to X many tickets for this sort of thing, and we resolved them in a manner that the community was happy with. So this is an opportunity for the city to really sing its own praises here. And again, I spoke about the housing and meaningful employment resources. This is something that the city really needs to focus on and making sure that there are employment that's targeted to folks who are at risk of violence or at risk of victimization, and same with housing. We heard that there is serious issues with housing targeted at juveniles who have maybe been kicked out of housing previously, and this is something that lends itself to both future contacts with the criminal justice system as well as victimization. And finally, which I think we've spoken about quite a lot at this point, is facilitating coordination between providers who are either doing the same work or in the same geographies. And this is happening, and it's something that the city should be really excited about, because I think this is important, and it was something that was brought up a ton. A lot of folks said this happened in the before times, and this is something that we want to see brought back, and so kudos to the city for starting to bring it back. All right. Next, we're going to talk about the responsive services portfolio. This gets into the four programs that sit within the alternate response ecosystem: BCR, traffic, animal care and control, and thrown on online reporting. This is again a really, really strong foundation. They're already diverting or transferring almost 9% of these calls out of police response. And this is something that we thought was really exciting and something that the city should be really excited about. There are three big ways that we suggest expanding the non-police response types. And I'm going to kind of start from the bottom, but the first one is going to be establishing new responses. We think there is an opportunity to establish some new responses, specifically around what we said with the transport, but also looking at a mediation capacity. And I think this is something the chief spoke about earlier, the need for, but there are a lot of calls that are coming in for kind of inter-neighbor disputes, a lot of calls that come in for disputes between a customer and a business, loud music calls, or calls where the primary goal is just to have a report filed for later. This is something we don't need an armed response for, and we need the police to be focusing on violent crime. The second one is to expand some of the existing call types. This is something that, with the calls or with the responses that already exist, is adding the call types that are eligible to go. BCR currently has 2 types of calls that are dispatched to that unit. It's the BCR call and the BCR welfare check call. We believe that there's an opportunity to really explore some of these other call types and send them over as well. And outside of just behavioral crisis response, also with traffic control. Traffic control has the ability to respond to car accidents where there hasn't been a crime that's taken place and nobody's been injured. This would, again, massively reduce the burden on law enforcement. And outside of traffic control is seeing what other calls we can shift in to our online reporting, sunsetting the use of 911 to file these calls so that all of these calls are filed through 311 or 311 or online reporting and are tracked in a manner that allows the city to be able to get credit for that work. And the last one is our policy changes. One big thing that we know, or two big call types that we noticed. The first one was burglar alarms. The city doesn't have a verified burglar alarm policy. When cities do implement verified burglar alarm policies, they see the number of automated burglar alarm calls plummet. Milwaukee is a great example, reduced their call volume for burglar alarms by 95%. I think the city of Minneapolis gets around 11,000 of these calls a year. So you can imagine the call volume burden that you would reduce without having to dispatch anybody by just making these burglar alarm companies verify that this is indeed a bona fide burglar alarm before the call goes out. And lastly is looking at our overdose person down calls. Traditionally in Minneapolis, a police officer has been sent to these calls, but an arrest is made or there's a police action in a very, very, very small percent of these. These are essentially medical calls that we're sending police to as well. And this is something where we think a policy change where if we're going to send police, it's going to be as a last resort if none of the other fire, EMS, BCR are available. Our priority action items here are launching ResponseStat. This is an accountability tool to make sure that our responders, our alternate responders, are going to as many calls as they can as they're eligible for, and that they can elevate challenges if they have these. Secondly is a regular review of calls for service. This should happen at a minimum annually, where we come together and discuss calls for service that have been responded to by alternate responders in the last year and identify any additional ones that we should be looking to add in the future. And again, I mentioned expanding some of the BCR calls. Outside of solely expanding calls that are going there, we propose investigating whether or not BCR can start doing proactive outreach as well. This is to areas where we may have traditionally had a lot of calls for service. And so can BCR go out and conduct some proactive outreach to reduce the likelihood of some of these individuals' concerns rising to the level of a 911 call? Do we have multiple access points? We know the city is getting ready to implement their pilot for the embedded clinician within the 911 call center. We know that those same clinicians do follow up. Can we make sure that we have policies that as many folks as possible are being referred through the follow-up system so that we're catching folks that may have come through the police and reducing the likelihood that their concern again rises to the level of a 911 call? Next page. I spoke about expanding traffic-related calls. I got in front of myself here, but adding vehicle property damage and vehicle recovery to the traffic unit is what we're proposing. Vehicle property damage is happening when they're either a damaged car that's parked or if there's a car accident that's happening and the person isn't injured and they don't believe a crime has taken place. One thing I want to add to this is that within this, there should be a difference between those calls that can be filed at home. I maybe got a fender bender or I dinged the car. A crime hasn't taken place. My vehicle is still mobile. I can take it home and file a report if it wasn't involved in another car in the accident. This is something that can be moved online. And also making sure our traffic unit coverage is available 24/7 would reduce the number of calls that are going to police purely because the traffic unit isn't available at that time. We spoke about expanding online reporting. This is, making sure we have shoplifting on there if the individual's no longer on scene. Certain traffic crashes, some assaults, and forgery reports. These are things that cities across the country have been able to successfully move to online reporting. And again, the goal here is if you're filling out a report because the person who you believe committed the crime is no longer on scene, this should be done online. Having a police officer come and do this is not gonna change the fact that they're also just filing a report. Okay, which one next? And then again, I spoke about overdose and person down, but we want to make sure that healthcare problems are getting a healthcare response. We need to investigate some of the person in crisis calls to see if there's any more of those that can be moved over as behavioral crisis. Person in crisis calls we know are the ones that are currently getting the police response first. Looking at welfare checks, the city is getting tens of thousands of welfare checks a year. There's no reason why the police have to be the primary unit to go to those. We can explore whether or not this is something that we can send the mediator unit to if that gets stood up, or we can have BCR go out and conduct these welfare checks themselves. And then finally, in this list is the disturbance and unwanted person. What we find a lot in fast food restaurants, your 7-Elevens, places like this, is that during the cold weather, folks will come inside who may be experiencing mental health concerns, and these folks will just stay inside until they get kicked out. Rather than calling police for this is something that should be shifted over to our BCR folks. Next slide. All right. And our restorative services, these are our supportive services for folks who have already experienced concern and are looking for stability following a traumatic event. So we need to formalize the diversion programs. The city has a ton of really exciting diversion programs it has available to it. We saw the Behavioral Health Center, although it's not currently a diversion program, but there is a LEAD program in the city of Minneapolis for law enforcement assisted diversion or let everybody live with dignity, advance with dignity in Minneapolis. These are programs where there should be a formal policy for our first responders to transfer people to the care of these individuals in lieu of going to the emergency department or to jail. Right now, we know it's being done. It's being done through relationships or kind of through unofficial pathways. This is something where there needs to be a process and a policy that dictates when these folks are going over there to make sure it's being utilized and to see if there's ways that we can increase the utilization of these programs. The other thing that came up was victim services. There are great victim services programs in the city, but not so much if you're not a victim of a domestic or a sexual or a gun-related crime. We need to make sure that there is a solution for all these victims to receive care and to receive any benefits that they may be due for this. And this is something that we have written in our report a bit further about how the city should address this. Also, the school-based clinics and the public housing-based clinics are really exciting. We were really excited to read more about those. We know that in other municipalities that have implemented these school-based clinics, that things like youth suicide goes down, youth access to sexual health, to mental health goes up. These are things that make everybody healthier in the community. This should be evaluated to see what the impact of kind of removing these SROs and bringing in the clinics had on the community. But we believe that this should also be expanded to other schools in the city as well. So yeah, I'll just finish off by repeating again. The city has a really strong foundation. There are really great things that are going on. I think the biggest thing that's missing is just formalizing these relationships to pull it into the ecosystem that you want to have, that you've spoken about through the Safe and Thriving Communities Report and Plan. And so our hope is that our action plan will allow you to really get going on that and to kind of make that vision become a reality. Thanks a lot for having me today.
Thank you so much for the presentation. I'll first pass it to Vice Chair Wansley.
Thank you, Chair Chavez. Thank you so much. I have been looking forward to this presentation for many months now. So I just will start with slide 18. I wanted to know why the recommendation for external evaluation versus internal, because I know that's something that we've been in conversation about in terms of building up internal infrastructure to do that internal evaluation.
No, that's a great question, and both is the answer, right? So you want to be able to know that like these programs inside are working, but you also don't want to be in a position where if you're trying to build trust in the community and externally that you're always evaluating your own programs. So what an external evaluator does, it allows somebody to come in and look at your program and say, yeah, this definitely works. It's not something that has to be done every time, but really when you create a new policy or a new program or an innovative program, you want to make sure that it's been validated externally and it contributes to the larger conversation about safety in the community. And so there are times when you can do that internally, and that is, making sure the programs are being implemented with fidelity to the plan that you set in the beginning. But so the answer really, I guess, is both.
No, thank you for that. Then next, going to slide 23, just looking at the recommendation for implementing shooting activation reviews. I was really surprised to see this piece because it was my understanding that I thought NSC, or particularly our GVI program manager, were doing these. So I wanted to get clarity on just actually the timeline of this report to get a sense of maybe when you did this, maybe we weren't doing this at the time. So could you share the timeline of this analysis?
Yes, so this particular analysis happened at the beginning of the summer. So
Okay.
It may be the case that that's been addressed since then.
Actually, I was going to say Director Nelson. Oh, yeah, okay, or Director Harrington, either one, yeah.
I'll say
Yeah.
on mic, just so everybody can hear. Subsequent to our work with NYU beginning and them looking at that particular aspect, the Neighborhood Safety Department did start weekly shooting review meetings with GBI and YGBI.
Okay.
I'm going to repeat that. Yes, they are happening weekly. You'll recall that we hired a GVI program manager early spring, and so they are now happening weekly on a regular basis. Thank
Okay.
you. Sorry.
So prior to the spring, they were not, but now they are. Just
Councilmember, they are. I would say, though, that I think the recommendation from NYU is actually even a bit more expansive than having just GVI and YGBI get that information. Not to speak for you.
Yeah, I think it's the outside of just GVI as well. It's violence interruption. It's making sure that the folks who are at the school, the school-based interrupters, as well as the hospital-based interrupters, all are getting this information at the same time, so that they can immediately kind of start implementing their intervention.
step up. Yeah, it was my understanding, and again, this is pre-Director Nelson Brown, the Office of Violence Prevention under Sasha Conan and Josh Pierce, this was actually the norm. And MPD, there would be these weekly tables to do exactly what you were talking about, and we're actually going to have a follow-up presentation on that next to look at where sites across the city, we were seeing pockets of violence either increasing so we could rotate resources there. Though the Step Up program is a little bit different because it's hospital-based, but I was saying that to see if there were some changes there. But I thought, again, those meetings were already happening, but it's good to get clarification now. In regards to slide 24, I did have also, I was really excited to see that piece too. My computer just did some weird stuff. It's shutting down. It's been a long day. What? Okay. We're just going to skip that part. I don't even feel like messing with this. Either way, I was excited. I said this earlier, excited to see the 50% piece and really seeing this body do what we can to figure out how we invest in supporting resources to go towards whatever additional pilots are needed to reach that 47% that is recommended, especially when we're able to access the fuller report that aligns with the recommendations that you even briefly outlined here. And we even touched on some of that of the mediation services that we passed as a legislative directive earlier today, or even especially looking at juvenile or youth intervention services. I know that's going to be a big piece, but there's a huge ongoing conversation right now of just our strained law enforcement workforce. And if there's a dynamic where we can keep removing pieces of their workload and giving them to qualified professionals, I think that is the direction that we need to keep continuing, because we're seeing great outcomes from that. And as you mentioned, like, to be able to celebrate that. And we don't often do that. So it's good to finally hear we did something right as it pertains to like public safety, and that is not often the norm, but we are doing phenomenal work. And I want to say again, kudos to Director Harrington for being a phenomenal champion and leader and driving a lot of this work forward, and just this report has been a really great validator of that, and makes me super excited as we're approaching this budget cycle and next year to see the outcomes of the pilot that we're going to be getting more information about, and then seeing what else we can carry forward based off of your report recommendations. So that's, wait, let me make sure. Yeah, that's all I had.
Thank you, Council President Payne, Councilman Palmisano, and then I want to have a conversation with colleagues on how long people can stay so we can calculate the next presentation timeline too.
Thank you, Chair Chavez, and thank you for being here. First time meeting you, so I just, by way of background, before I ran for office, I worked on the team that helped design BCR, and this feels very refreshing because we are not, like, one of my big refrains that I have now is that it's time for us to have a mature conversation about public safety. And in the era that we all, at least majority of this body, came into office, we were on the front cover of the New York Times and with defund the police. And really with the conversation I was having, because we were coming from, you know, my team helped design BCR. We were making those recommendations around traffic control, making recommendations around online reporting. Our team built some of those initial tools. We got so far away from the practical realities of some of these ideas. It's really good to see some of the grounding back here. And one of the big points of grounding that I think, I don't know if I want to say this is missing, but we do have a number of assets, and it is actually so refreshing to see somebody come and say, by the way, you guys are like way ahead of other peer cities, because it doesn't feel like that to us sometimes because we've been in such a traumatic, like, constant headspace since 2020. But there are actual programs that are successful, but I don't know if they're always utilized. And the one that comes to top of mind for me is the youth auto theft diversion program. This is something that our county attorney has come to this committee and presented on, and it's been demonstrated to be really successful. But it doesn't seem like, you know, there's a clear pathway into that program. There's an expectation that MPD would be a source of referral for that program, but it seems like for some reason MPD is not leveraging that program where they could. And I don't know if that's we don't have good policy in place for MPD to leverage, whether it's that program or any of the other existing programs, or if we don't have the right data sharing agreements to do these things, because I know in some of these instances, the police, the schools, the parks know exactly who the kids are that really need some support. And it just seems like we don't know how to get, especially for the young people, into some of these programs. And so I was wondering if you could expand on not just the existence of some of this good programming, but the underutilization of some of those programming, and like what interventions we could do or resources we could bring to either make sure that we have the right policies in place, the data sharing agreements in place, or the budget in place to make sure that, aside from like building new programs, what about the programs we already have?
Yeah, that's a great question. Thank you very much for asking. I think going back to a couple of points made earlier is making sure that the policy is there. That makes it very clear when the individual should be referred to some of these diversion opportunities or deflection opportunities or any of these kind of opportunities. having a policy that says when that person should go, having a system that documents that. Alex Heaton was arrested today, or he was detained today and was taken to the behavioral health center to detox or sober up or whatever. Have all of this in there, and then you have the accountability mechanism. So if it is the police, is this being included in MSTAT? Are they being able to say, how many people did you have detained or arrested this month who would have been eligible for these programs? What percentage of them did you move over there? If there are concerns with data sharing agreements, I'd say how are the local universities being engaged for this? I imagine all of the municipalities within a 5-mile radius of here have data sharing agreements with the University of Minnesota. Are they being engaged so that you can kind of use them as a safe place to identify who maybe should have been diverted and evaluate the longer term impacts of that happening. And so these are kind of the structures that we suggest are put in place whenever you have a diversion opportunity or a deflection opportunity, or any of these. But the accountability mechanism is key. What percent of folks are you diverting who are eligible? What system do we have in place to identify those folks who are eligible to go? And then check in on it regularly.
Thank you.
Thank you. Next up, we have Councilmember Palmisano.
Thank you, Mr. Chair. I'm trying to figure out how I could be as brief as possible. I guess I too would like to ground my comments in what you said earlier about Minneapolis has a strong foundation on which to build. I think that's a great starting point, and I'm glad to see that that the work we did in the past regarding BCR and traffic control and 311 are starting to pay off, because these employees and these community partners are really doing important work. Now for the hard part is kind of what the rest of your presentation was about. When you talk about governance, I really appreciate the note to determine which programs we have that contribute to community safety and challenge us to measure their success. I'm not so sure that we do a good job at measuring their success right now. I don't know how some of these ideas might leverage work we have with our partners, like at Hennepin County. We do a lot of duplicative things, like Hennepin County. On slide 17, you noted create criteria-based referral policies. Are we not doing that now, or are we just not doing a good enough job at it from your review?
I think this goes into some of the comments we had about the juvenile diversion programs. We couldn't identify policies for a lot of these, whether it's diverting people to the behavioral center, the use of the youth coordination center, looking at how these places exist and how folks go from their first contact with police or with fire, or with BCR, EMS, how they go from that to being in one of these alternate destinations instead of jail or the ED. So I think we couldn't find almost any policies on that. And so I think that's something that should be clear. And if they don't exist, put those together and write those so that folks can be held accountable for using those, but also so you can see if they're working and see how many folks are kind of being diverted from these traditional destinations as a result.
And I want to say, I think that's a harder lift in some regards than people give credit to. You'd think it was just trying to rip out some government bureaucracy, but there's very real reasons why data sharing between these different entities are hard. I experience it between BCR and my office, for example, when we call on constituent things. It's hard. BCR has some very firm health kinds of rules where their stuff would be entirely separate from MPD kinds of information. So I also appreciated your mention of transportation to other kinds of referral services. I have been on ride-alongs with BCR, and while that wasn't really a part of my day, my one single day there, it does seem like a big need that is one of the main, well, I don't know about the main, it's a very important service that they're providing.
Yeah.
Is to helping people get somewhere when they are ready to go, and that can be at any time. And sometimes it's really important to catch them in that space and that window of a willingness to go somewhere and seek the kind of help that they need. It seems like that could be low-hanging fruit, but I know that that's part of one of the services that our BCR team provides. I do want to just ask, this seems like a non sequitur, but verified burglar alarms. I believe that in our city, a mistaken, something setting off a burglar alarm is kind of a one-time give. After that, there's a fee charge to try to
That's correct, yeah.
help disincent. Are there other kinds of policies? Like, what would help verify a burglar alarm if you aren't going to send a law enforcement officer there?
So in these cases, that's a great question. Thanks for asking. In these cases, what we see other municipalities doing is they require the burglar alarm company to either call and check in and say, is this an actual burglar alarm? Some are required to have a video, or some are required to send through a private agent of their own to say, yeah, indeed, this is something that's happening. Again, when this happens, the use of these automated burglar, or the false positives of automated burglar alarms really do plummet.
Thank you.
Thank you.
Thank you. We don't have anybody else on queue, so thank you so much for the presentation. I think it's been really helpful, and I appreciate the quick turnaround, so thank you. Vice Chair Wansley.
Just Director Harrington, would you give thorough updates in your emails? Can you just, in your next update, when the report is done, just inform us?
Chair Chavez, Councilmember Wansley, I will absolutely share as soon as that report is done, and we will put it online.
Okay.
We will make that publicly available because we're trying to increase transparency in all that we do as well.
Okay, thank you.
Thank you. All right, so seeing no further questions, I will direct the clerk to receive and file that report. Now, colleagues, we cannot stay past 5:30 p.m. because we have captioners here that are helping us make sure that our meetings are accessible. We have a presentation on the overview of data analysis and processes for the way we use our safety services. My recommendation here is to get through as far as we can on this presentation. And then whatever we don't get done, I think we just wait till next year unless there's a different recommendation that folks on this body have. But I would just say that we get as far as we can today and then figure out our next plan with that. Cool. Cool. Thank you.
Thank you. Thank you. Can I start? Do I have to? Can I start? No. Start. Okay, thank you. Thank you so much, Chair Chavez, Vice Chair Wansley, and council members. I will go through as quickly as I possibly can.
Before you go, Vice Chair Wansley.
Yeah, I'm just gonna. I'm sorry. I know we're at the crux, but I really do not want to rush this one in light of this. And I know my co-author, Councilmember Cashman, really also wanted to be here to answer questions. So I will make the motion to postpone this one to the first PHS cycle, so that way you don't have to rush through. We can sit with it, ask thoughtful questions. Again, she can be here and ask questions too. Yes. So I will make that motion if this committee will support that.
I think what we can do with that, well, I'll support the delay. I think for the next cycle, which I believe is January 8th, I think what would be helpful is if we can just email this presentation to the body so that at least they have access to it and at least they're able to see it. And if folks have a question between now and January 8th, they can reach out to your office.
Absolutely. I would also offer, I'm willing to provide a narrative, a little bit of narrative along with the presentation, so that council can have that during budget proceedings as well. It'll just be like a synopsis of what you would have heard, and then in January give the full presentation.
And this will be included on LIMS to our automatic, because we have it already, right, Joe, right?
Once I get a digital copy, yes.
Right.
Awesome. But it'd still be good to just send it to all colleagues, or either send it to me and I can send it to everybody. But I think coming from NSD would be helpful, saying this is presentation we're going to get in January, feel free to reach out to our offices with any questions. That would be helpful.
Absolutely.
So
Yes.
I will support the delay.
Yeah.
We'll move that to the Public Health and Safety Committee on January 8th is, I believe, the next meeting. Okay.
And then can I also just get in queue for a
Vice Chair
separate
Wenzel.
question?
Yep.
As a staff motion, this will be, staff motion. This will be for the city attorneys, just to follow up on our first OCS update. I did want to ask, why aren't we doing at least a gift acceptance, again, in pertaining for the NAACP partnership or even the Unity Mediation Team? I'm thinking of, we even had to do a gift acceptance from Ryan's company when they offer pro bono services to the mayor's office for a number of executive services for OCS. And I think they were also trying to help with the executive search for CPED or something else. But there was a gift acceptance to do pro bono. So if we also have another organization offering free services to the police department, why we aren't doing that. So that's a staff memo question that I would love some follow-up for, that I'm pretty sure we can't take care of today. So I just wanted to get that on record.
Okay, so I guess the staff question is relating to the mediation contract or services that the city is partnering with NAACP. Okay, cool. And if,
The Unity Mediation Team.
thank you. Okay, so is there any discussion on the delay? All right, so I'm going to move forward. I'm going to delay this one cycle or until the January 8th, 2025 Public Health and Safety Committee meeting. All those in favor say aye.
Aye.
Those opposed say nay. All right, that passes. And seeing no further business before us, I would declare this meeting adjourned.